like to call this meeting the Jefferson County Board of Education to order. This is our regular meeting, September 27th. We do in Jefferson County schools require masks in buildings, and we need masks on at this time. We need masks on at this time. Makes me feel a lot better, yes ma'am. Please join us in the pledge. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mrs. Skinner is out of the area and she'll be joining us virtually. We have a presentation by Dr. Reedy. Dr. Reedy?
Dr. Reedy will also be joining us virtually, and Jason has him up.
Okay. Hello. In the past month and a half since school started, we have continued to see a lot of cases of COVID. Last week they had hoped that the number of cases in the state would peak, and in some places they have. Berkeley and Jefferson County are still having increased numbers, although the last couple days we have seen slightly fewer cases coming in. Since the beginning of August, we've seen about 300 cases of people 17 and under. That compares with about 200 earlier in the year. We're not having problems, as some people pointed out, with children being extremely ill. Fortunately, that's a rarity, and we hope that will remain the same. We are seeing a large community transmission and a lot of people requiring hospitalization. Dr. Clay Marsh at WVU describes the current status of West Virginia medicine and other hospitals as being at the critical phase, meaning they're pretty overwhelmed. Other hospitals have similar problems. There are disproportionate number of people requiring hospitalization who have not been vaccinated, which is unfortunate. It does show that the vaccine is helpful in protecting against the more severe forms of this, and that the cases are not simply the very elderly. There are a fair number of middle-aged people, not always people with prior health conditions who are getting sick and ending up in the ICU. The numbers statewide of people in the hospital, in the ICU on ventilators is significantly greater than at the peak this past winter. We expect the numbers of hospitalized or people on the ventilators, unfortunately people dying, will remain for 2 to 3 weeks after the peak has subsided, just because it takes that long after becoming infected till many people have the worst of their disease. I don't think we're in a position to be relaxing our restrictions. We are not seeing many cases at all of in-school transmission. I'm aware of just a couple, 3 cases where it looks like one student in a classroom may have infected the person next to them, usually in a lunch situation where the masks are off. As we had last year, outside of the classroom, whether family or friends or in extramural activities such as sports or other clubs, there is transmission. Sometimes it's with the activity, often it's with visiting with the friends, riding in a car, having meals together. So we haven't seen anything new in that regard. It still goes on. It's still very disheartening when people have to miss school. Many people, fortunately, have very mild symptoms or no symptoms at all, and they're surprised that they have COVID and have to isolate or quarantine. I'll move on to the questions.
Questions? Board members, questions?
Yeah, I have some questions. Let's see. What about the possibility of rapid COVID testing in the schools? Do you think there is would that be helpful? Is there a need for that? Because I understand that there is a high rate of uninsured children who don't necessarily get the testing quick enough, and so they may be carriers. Is that my understanding? Is that correct?
So we have been discussing doing testing in schools, and the state does have a mechanism for contracting with laboratory companies to do that. But the test is only a piece of it. The other piece, and this is what happens when you go to an urgent care, is the evaluation of what that test means. Whether someone who has it and has symptoms still may be positive and it's a false negative, or if it's positive, what do you need to do about it? And if it's negative, what does that mean? So there's a lot of discussion. The school nurses and nurses with health department do have these discussions, but the providers at the places people are going to get the more rapid tests, that's what's happened. So we're looking at it, but in addition to doing the test is the advising, the scheduling, deciding which people should come in to get scheduled. It's as so many other things, it's, who are the staff that are going to be able to do this. It's already stretched pretty thin.
I understand there's $55,000 available. I don't know if that's been used, Dr. Gibson, for to hire someone to do contact tracing. And is that available? Did we receive that funding?
So I think Dr. Gibson could speak more about that. We're looking at it, but that's for an extended period of time, and then getting someone on board and getting them, developing the system and training them will take time. I'm not sure it's going to answer the need right now. Unfortunately, most places, the RNA or the PCR test that is more specific and accurate, because there's so many tests being needed, not just in this area but elsewhere, is there's sometimes a shortage of supplies and a delay of a day or two, and in some cases 3 or 4 days till we get the result. Not quite as bad as last year, but approaching it. The rapid tests, the antigen tests are valuable, but they do have to be interpreted based on the person's situation.
Well, my daughter is 22, and in 5 minutes, she was trained and she ran the program in Berkeley County. So I don't know that it's that intensive. I think we did a program here, but it was the staff that ran it. So it sounds like there's money available, but I don't know, Dr. Gibson, is that correct? Did we get that funding? Did we apply for it? I saw the information you sent that, yeah.
So first of all, when you talk about what the staff has done previously, we've conducted the vaccination clinics. We ran 8 vaccination clinics with our own staff. We have not conducted testing with our own staff.
Okay.
We don't have the qualifications or the testing kits. We haven't had the qualifications or the testing
Right.
kits to do that. So we did apply for the grant funding, which was $55,000. As I sent you that information, and we did go to the health department and make a request that we be able to hire someone, as he noted, in terms of a shortage of individuals and testing materials and supplies. That's certainly the purview of the health department. If there is a way that we could have individuals who are able to be trained more promptly or access to tests more quickly, we applied and we were awarded that grant. So
I was thinking maybe Shepherd University, they already have an established program of rapid testing, you know, they use on campus, so maybe we could work with them, somehow. But I know that, the other thing I wanted to ask is, what happened to the discussion about deep cleaning and social distancing? You know, why is the emphasis only on masks if we are trying to do everything we can to keep our staff and, you know, students safe? Why aren't we doing everything we can? Are they not as effective anymore? Deep cleaning and social distancing?
The deep cleaning is not where the focus is that it was in the very, very beginning of this. Cleaning frequently touched surfaces is still beneficial, but that does not seem to be the major way of preventing spread. Social distancing is extremely important. Masks are a little less important, and the lack of social distancing in extracurricular activities probably explains a lot of the spread. So we haven't discontinued that. There are a lot of gatherings that, you know, whether it's attending sports events or other kind of gatherings, are certainly areas where a person could get infected more easily because they're around many other people, any one of whom could have an infection and be in the highly infectious state. So you increase your risks.
So it sounds like you're recommending social distancing for the schools. Is that correct?
Yes. The State Board of Education, Department of Education had very extensive guidelines last year on all sorts of different aspects of cohorting and social distancing and everyone eating in their classroom. From the standpoint of decreasing the spread of the virus, I think that would be very helpful. The realities of implementing it, I have to leave that to the school. But it certainly is important. And then also what the activities are people do outside of the school. We have talked to parents who think when they isolate or quarantine their child, it only has to deal with school, and that they can then go play their sports even though they're infected. It's not, you know, while they're infectious or when they've been exposed, the other activities outside of school should be affected just as much.
Any other questions, Tom? Laura, Gary?
I've got a question, Dr. Reedy, about two questions actually. One is about the quarantine guidelines that we've been working with, and if those have changed, and if not, what would be the repercussions, I guess, for us as we begin to move towards figuring out how to live with, you know, a new normal, which I'm assuming this is probably going to be at some point, but so we can figure out what is the risk benefit for us for masks and no masks as far as quarantining classrooms?
So the risk benefit's hard to put numbers on. A lot has to do with how much infection is presently circulating in the community. When that number goes down, the chances that each person you come in any person you come in contact with could be infected goes down. So the risk and benefit decreases. The risks of masks are primarily inconvenience and people not wanting to be told, though others will say there are physical risks. That's not what most medical community has found. The benefits of people who are infected, isolating remains high until this becomes a non-dangerous virus that anybody who gets it is going to have a very mild illness like the cold. Then those who are infected should stay away from others. Same as we recommend with the flu, but this is still far more deadly than the flu. Fortunately, children are not the ones that are primarily having major health problems from it, but they can then increase the spread and others can get infected. So it is fortunately relatively benign in their cases, but they need to isolate because allowing this disease to spread throughout the community has community consequences. Hopefully we will get enough immunity either through vaccinations or people who have had the virus that most of us will, with future exposure to the virus, have less and less severe illnesses, that it becomes more like a cold or even more like the flu. That's our hope. Time will tell whether that's what happens. That's some of it when people talk about herd immunity, is that you have enough immunity in the population that when people get infected, they don't get very sick and they're less likely to transmit it. I'm hoping that's in the next couple months that we get there. I saw numbers today that between the number of people in Jefferson County who are either vaccinated or have had proven infection and therefore have some degree of natural immunity, and the rest of the population, we still have about 25 of our 57,000 people who have not been exposed either through vaccination or virus, have not been, the immune system hasn't been activated. So we have a long ways to go compared to some other counties with higher vaccination rates.
So is
We
it,
can get there.
is it still, right now, the policy that we're following through the health department that if we have students in a classroom, if we took all of our masks off and we had one exposure in the classroom, that the entire classroom would then have to be quarantined?
That's, since we have masks, I don't, and most of the schools in the state do, I'd have to look at it, but I think it's more that people without the masks within a certain distance would automatically have to quarantine, but not necessarily everyone in the classroom. If you're talking about the very young classes, first, second graders, where there's not the social distancing, then that's a whole different matter than older kids who are able to sit in their seats.
Here's Snapchat. It sounds like social distancing is crucial here, that you keep mentioning that's important, and are we social distancing in the classes? Dr. Gibson?
Yes, ma'am. As always, to the extent that we have the physical space to do so, and while the weather's nice to be able to get the kids outside, having subbed in several of our classes, yes, their desks are apart. We are not doing group activities. We're not again, to the extent that we possibly can, when we have kids who are all down here in a reading circle, we're drawing little squares and asking them to sit in little squares. If you're in K1-2, that is a lot harder done than said. At the upper grades, the kids are doing a better job, but as you know, most of folks have sent their kids back to school. They want their kids in school, their kids need to be there, and we don't have the physical space in our schools to maintain consistent in every single venue at every single time social distancing. The only way to do that would be to have kids attend school in rotations. If you had 50% of the kids come one day and you could spread them all out, and then 50% of the kids come the next day and do it on rotations, yes, you could get a good deal of social distancing. But right now, the significant portion of our kids are in school. So again, to the extent that we have the space possible, yes, but is that the full 3 feet in every single case all day long? No.
With the parameters that we're taking right now, are we seeing any significant, I think Dr. Reedy said, you know, he didn't necessarily see anything significant that we are getting any kind of crazy spikes, but compared this year to last year with the number of students in the classroom, I know the Delta variant's different than what the other one was, but I mean, there's so many different variables and they change every day, but what are you seeing as far as on the ground for us in the classroom?
Number one, I'm seeing that we need a lot more teachers and a lot more staff, but I see some people who are killing themselves every day to keep this place open and make it work. As far as quarantines, we have had sports teams quarantined because they're not masking, they're in a group and moving around, so when they do contact tracing, if they can't be certain, then there's a safety level that they quarantine them. And we've seen class quarantines off of lunches, kids who take their mask down, eat their lunch, and they're in an enclosed space. And we've seen ones where we have kid come in and they've been exposed, and then kids who take their masks off or are playing outside with them at recess. So we have seen some class quarantines. We have not seen a whole school quarantine. And we haven't obviously had a closure as a school system. So to my knowledge, there are 2 school systems in the state who've had to go full closures. And those have been a combination of quarantine and a lack of staff. And there have been 8 total schools as of, I think, last Wednesday's report, who shut down from a lack of staff due to quarantine as well. But we haven't had that circumstance here.
I have another question. So at what point do we need to get serious about social distancing in the school? Are you basing it on a percentage? You know, whether we're in the red zone, or what are your thoughts and recommendations before, as a preventative measure, so that we don't have to close down? That's for you, Dr. Reedy.
Again, there's no easy guideline on that, and it requires considerable discussion, and what aspects of further social distancing. We have had some discussions about getting rid of the more open lunch. It's kind of different with each age group and each school, but that would be one place. But mostly within the classroom, we're not seeing spread. The good thing there is that those are set cohorts of people. That it's not 100 different people you're exposed to every day, but your class. I'm pleasantly surprised that we've not had the number of in-class transmission that we thought we might. I think the largest we've had in any one classroom is 4 different people, which is pretty good out of the thousands of students that you have. Each day it's a new challenge, but whether if there was big transmission, whether you close the school for a week like you do in the flu occasionally, there are a lot of different measures. Most people, I think, are taking their measures seriously, keeping their kids home if they're not feeling well. You know, those are the basic common sense things that I do think are making a difference.
Do you think that it's the masks are a contributing factor, a significantly contributing factor to preventing?
I think so. I can think of 2 in-school transmissions, and they both occurred with someone they sat next to at lunch. You know, whether that's where they got it, you don't know. But that's the highest time of exposure, and if the masks are off, people are talking loud. They're within 3 or 4 feet of each other. So that's not a big surprise. How much more strict you get on all of these things is difficult. Anybody that individually wants to be more strict, I think that's great. For example, people who have been vaccinated do not need to quarantine if they've been exposed, but those who choose to quarantine because they realize that compared to a few months ago, we know that they could get infected and they could infect someone else, and that has happened. It's less likely, but those people certainly could quarantine. They would be more strict than the guidance requires. But we can't mandate that. I can't mandate stricter quarantine than the state is authorizing.
So are you suggesting that there be social distancing at lunchtime in the cafeteria?
To the extent feasible. And so in the younger grades where they have assigned seating, it's very helpful because when one person is infected, you know exactly who they sat next to. My understanding is that in the older grades, it's a little harder to keep them in assigned seats, and it's not the same social distancing or cohorts that we would like. I would need to leave that to the professionals in the school system about what's possible with all the different demands and pressures. But that would be ideal.
So is that reasonable or realistic, Dr. Gibson, to social distance at lunch when the masks are off?
It is only reasonable if we do one of 2 things. Either we change the lunch schedules to extend over a schedule far beyond what we do now. Part of the issue is that in terms of making the lunches and then keeping them hot and then spreading them over, if we have such small groups in the lunchroom at a time, lunch will start at 10 o'clock in the morning and it'll run until 2 o'clock in the afternoon. Already at like our larger schools, like at Jefferson High School, she's divided it up into 4 separate lunch sections in an attempt to keep the group smaller. The biggest issues that we have, number one, their space. We do have some classes who were rotating out and they have lunch in their room one day a week and then they rotate back into the lunchroom in an attempt to keep the numbers down. We also have, like at some of our elementary schools, we have clear dividers on the lunch table so that it would help if everybody was facing the same way. Our tables aren't set up that way because they're the fold downs with the round seats. So those we've purchased dividers and put those in there, but to the extent that he's stating, like in some schools we're able to put kids every other seat, that is a rarity, I will say, that we're just not built for doing that. So the only other choice is to rotate them in and out of classes, and then you've got them in a classroom, and that's when we'd be getting full class quarantines as well.
Well, do you have a cutoff, like a plan of, okay, when we get like a certain percentage of kids out of school or exposure, then we're going to move into this next phase of more social distancing?
Well, we're at the maximum amount of social distancing that we have right now based on the space and schedule that we have.
No, I mean at lunch, like in the cafeteria.
I think the real question though is, we've had school since we started to now.
Yes, ma'am.
And so we have some really good data to look at of what's actually happening in our school system. And if we can honestly say, and it sounds like I heard Dr. Reedy say, that what we're doing, even with the distancing we have now, is working, we're not getting any mass crazy outbreaks, we're not having any issues. Yes, we have to watch it. Yes, if it happens, that's usually where it is, but it's not anything that's over the top, number one. And number two, we've seen this spike that we kind of keep hovering at, doesn't seem to be increasing, so it does look like we're kind of coming over the edge of it. So I don't know that more restraints at this point would be necessary. It sounds like we can look to, okay, we're holding steady. We're trying to get to a place where we figure out, again, which we talked about before, Dr. Reedy, what is the level of risk that the health department is willing to take to avoid the quarantines, right? For us, it's about the quarantines. It's about keeping kids in the schools and keeping kids in the classroom so that we can educate them. So when we get to the place where we have the quarantine issues will lax so that we can have school as we want to have school and just move forward as a community. What are we looking for? What's our level of risk? What's our number? What are we looking for as a county? That's the question.
Excuse me, if I could just finish my question, because Dr. Gibson hadn't finished when you interrupted. So I'm just wondering, do we have a plan of any certain, at some point, or you just play it by ear? You just wait and see how it goes? Or is there a time when you say, okay, we're going to have to do more. We're going to do the rotating of going to school and staying home, or we're going to do more social distancing in the cafeteria, more rotation of, using the cafeteria. Is there any kind of a strategy, or are you just kind of waiting to see?
There's a couple of ways to answer that. Number one, in terms of whether or not we have a strategy if we get larger numbers, we have one for a 48 to virtual, 48 plus, which is where we have a way of rotating classes onto virtual on a schedule for those students. We have a couple of options that we've spoken about, none of which we want to enact. And those are strategies of having kids come in and be on virtual on rotating schedules, much like we did when we originally opened schools, because that lowers the numbers in our schools significantly. We do not want to do that. It is an absolute logistical nightmare, and it's incredibly difficult for kids, for children. At this point, if we had such significant numbers that we met the outbreak criteria for a school, at this point we would send the students full virtual until we pass the quarantine period and then bring them all back in. We haven't, not us nor anywhere else in the state, seen rolling outbreaks where they have a whole school has an outbreak, shuts down, comes back, rolls, shuts down, comes back. So that hasn't happened yet. If it does, we certainly would recommend to the board a hybrid schedule to prevent that.
Okay, so it's based on the outbreak criteria. I'm just
Yes,
trying
ma'am.
to give information to the public, because I know people are wondering, so what's going to happen, in a week if there's an outbreak, so.
Thank you. That's a great question. On our website is also the criteria from the West Virginia Department of Education for how they define an outbreak, their masking recommendations, and what their WVDE and WVDHHR joint recommendations are for schools. So we have that posted up, and that might help people as well.
Thank you. You're welcome.
Okay, Mrs. Ogden, I think you had a question.
Yeah, are we giving the same opportunity for students to not have to quarantine if they have a proven exposure, proven COVID diagnosis, just as well as being vaccinated?
So if someone has had COVID infection within the preceding 3 months, they're considered extremely unlikely to get infected or to transmit to someone else. But that would, we'd need to be able to see that, which we can see who's been infected. And that's one of the things I tell, parents who are so, upset because their kid can't go to school, though they feel fine, is that having had a proven infection, they kind of get out of jail free card for 3 months. People who have been vaccinated, there's not a time limit on that right now, but those people with good immunity do not have to quarantine right now. Whether the immunity with vaccines, how long that's going to last, this is still uncharted territory, but I think that it will still, even in months to come, will still give substantial protection as far as less likelihood the person gets infected, and there's some evidence that if they are infected, they're less likely to transmit it, but that's, we'll have to see on that.
And then my last question was just that level of risk. Have we defined that as far as what we are going to, how are we going to move forward as a community? When are we going to get to that with the same way we do with the flu and everything else? What is the level of risk that we are able to then not have to quarantine, not have to do those types of things?
So that's not been decided. I think using the color map when we're back down in the under 10 or the green or the yellow, that really looks good compared to where we are right now, that we in Berkeley and many counties have been in the red the whole time school's been in session. So at that point, then the mask requirement would, most likely go away. There would, the purpose of all these is to decrease transmission. If we're not seeing transmission, we can relax. And the increased social distancing in the schools, if we see increased in-school transmission, then we need to do more. Fortunately, we're not seeing that right now. What could happen at one school may require actions in that school, but not for other schools. That it's just different. So you may get an outbreak or flare of cases in one place, but not somewhere else. And that's not unusual.
Ma'am, this is questions from the board to him.
The
It's not
things
from
keep
the
coming
Any
down, in
questions?
a month or two, we will be, throughout the state and nation will be much better, but we have to watch and see because we don't know for sure. Winter is coming and people will be more indoors. Whether that's going to lead to more transmission, we do not know yet.
I'm sorry.
Vaccinations are still available for, 12 and up, people who haven't gotten them, and maybe at the end of October they'll be available for younger. That's not been authorized yet.
I'm sorry. This is the discussion between the board and him. It's not-
Okay, so we can't ask any questions,
No,
Doctor?
no. Mrs. Skinner, do you have any questions?
No, I'm good, thank you, Mr. Ross.
Okay. Is this the appropriate place in our agenda to address, okay, is there a motion either for masking or not masking in our schools from now till October 25th, our next meeting in October?
Mr. Osborne, I'll make a motion to extend this.
Excuse me, order. We are having a meeting.
Are we?
Yes, ma'am.
Doesn't feel like it. Yeah.
Well, it is a meeting and we have a motion on the floor.
Could you repeat that, Kathy, because I couldn't hear you?
Kathy, can you repeat that motion, please?
I said I'm making a motion to extend the mask mandate until the second board meeting, October 25th.
Is there a second?
I couldn't understand what she was saying, I'm sorry.
Mrs. Skinner made a motion to extend the mask wearing till October 25th.
I'll
Second.
second.
Discussion.
Second.
All in favor, say aye.
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 I
Opposed, no. Motion carries till October 25th. Okay, report from Deputy Superintendent Joyce White.
Shame on you. Yeah.
Excuse me.
Shame on you.
There is order. or we will stop this meeting right now.
Oh, is that right?
Yes, ma'am.
Welcome to Nazi Germany.
Okay.
We're out of control.
Deputy Superintendent Joyce White, please.
Thank you, sir. Ms. White is not with us this afternoon, so I'm going to give her presentation. First and foremost, an update on bond projects. The C.W. Shipley bids for the awning at that school for students' protection from out of the weather will be in on October the 8th. Once the board awards a vendor, we'll schedule that project. It will, of course, the work will be completed when staff and students are not present over the holidays, likely. The fall projects include the planning of our 2 new schools. Hopefully, many of you saw where we had students together in committees at Ranson Elementary and Shepherdstown Elementary. It was actually a wonderful experience to sit down and hear them with the architects and the interior designers talk about what they wanted to see in their new schools and how excited they were about it. So we will be posting up on our website the timeline for the 2 new schools. Right now, SBA has a series of different phases. The first one, of course, is the planning phase submission, and that is pending receipt of the survey. We anticipate submission on October the 8th. The schematic phase submission, and that's where we give them the floor plan, exterior elevation, schematic plan site. That will be submitted on November the 5th. Design development submission, technology plan, outline specs, HVAC systems, detailed floor plans, building sections, March the 4th. Now, between that November 5th and March the 4th, we will have a series of meetings with the public where we'll show them different designs, taking into account the teacher committees that we had from both schools, the public comment that we've had already, and the student committees and feedback from SBA. There will be drawings, schematic designs, site showings, and that feedback process will continue. On May 27th is when we actually submit the construction drawings, drawing specifications, and then we actually start bidding out to contractors. After that, the projects can be advertised for bids on or around June 20th. 2022. Now, this is the SBA schedule, and the SBA is the one that conducts those advertised bids. Construction, we anticipate beginning mid-August next year with construction completion spring or summer of 2024. So we know a lot of folks are anxious to see those go up. We do anticipate, based on the bid that we put before the SBA, that both sites will have a camera system while they go up where people can see the buildings actually rise and monitor the building of them for transparency for the public. In terms of technology, all of our Chromebook one-to-one devices are out to the students. The one-to-one device committee provided bags for laptops in grades 3 through 8. And some students in other grade levels depend upon a variety of factors, but students in grades K through 2 don't actually take the devices home. They use them at school, but given their level of just responsibility and cognitive development, and they come home sometimes and can't remember where they took their socks off during the day, much less where their laptop is. So the upper grades, the grades that we're the 3 through 8 that we're giving the bags to, when we worked with the company and they gave us data on breakage rates, those are the grade levels that we targeted for the bags. So we are also continuing to work with the computer systems for our learning management system and Canvas. We have a training for all staff on October 11th on our staff development day. On Canvas and Weavis for our staff, from service personnel to professionals to administrators. So continuing to move forward with that project as well. So thank you, sir.
I had a question for Ms. White. I don't
Okay.
know if you can
I will
answer.
do my best. If I don't know the answer, I'll take it down and take it to her, ma'am.
Mm-hmm. So I'm just wondering how much money would be the difference if we were to build a pool? I mean, I see that there's some extra money in the budget. I know that we spend a lot at Shepherd to use the pool, and our students get a lot less practice because they have to share the pool with several counties. And then you have the kids that live on the mountain. It's at least a 45-minute drive to get to practice. So they miss out. So, you know, it would make sense at some point to build a pool for our students. Has there been any kind of study to look at, you know, how much, because I know there's the concessions and there's the entrance fee to the pool. So, you know, I know that a pool is expensive, but, you know, do we have those numbers of, you know, how much we might save versus how much it costs?
We haven't done a comparison of the cost of both installing and operating a pool versus what we expend at Shepherd. I can bring the board the contract that we signed with Shepherd, both for our swim teams to practice, and we run a special program for students with disabilities for their safety to learn how to swim. We did have some discussions with Jefferson Parks and Rec because they had been approached by a donor with the possibility of putting a pool in at Sam Michael. And so we had spoken with them about, if that happens, you know, could we possibly work with our students? What would be the time sharing of that? That donor didn't materialize, that didn't actually show up. But so we haven't pursued that. But we can speak with the architects and get a rough estimate of what that kind of facility would cost, both to build and to maintain, if that's something the board is interested in knowing.
Well, our students now have to go to Frederick and to use the facilities there. They join teams in Frederick so that they can get extra practice. And like I said, the kids that live up on the mountain, it's 45 minutes one way, and if they don't have practice until 5 or 6 o'clock because they're sharing the pool with Berkeley County or another county, you know, they have to rely on somebody that can take them to practice and then somebody that can pick them up. So they miss out on the opportunities. So at some point soon, I think there should be a pool, at least, you know, for the students, one pool.
Well, again, we can certainly get numbers on construction costs and on maintenance, and we can bring those for the comparison for what we expend at Shepherd University, and the board can take a look at that.
I appreciate it. Thank you.
You're welcome, ma'am.
Next is approval of the minutes. We're talking about the regular board meeting September 13th, 2021, and the special board meeting held September 14th, 2021. Is there a motion to approve those minutes?
So moved.
Second?
Second.
Discussion? All those in favor say aye.
Aye.
Opposed, no. Motion carries. Okay, next is citizens' comments. And just to remind speakers that all speakers are limited to 3 minutes. Speakers are prohibited from making negative or derogatory comments using a name or position by which the individual can be identified. Comments may not be threatening, profane, vulgar, or abusive, or the speaker will be required to cease their comments. Speakers who deviate from the information provided on the speaker's form will be called out of order by the chair and be required to cease their comments. Public comment is not a question and answer period. It provides individuals with the opportunity to express their comments regarding any subject matter. All comments shall be directed only to the Jefferson County Board of Education. No person may address or question board members or Jefferson County school staff individually. The board will not respond to comments made during the public comment session. All speakers are requested to provide contact information below should it be necessary to seek clarifying information, correct a factual error, or provide specific feedback to a public comment. Virtually, we have Elizabeth Kerwin, and after that, we have Dale Nesbitt.
Hi, I'm here. This is Elizabeth. I just wanted to thank the board. Thank you, thank you, thank you. I know this has been tough. I want to thank you for having made the decision to require masks up until this time. And I appreciate you for keeping my son and his classmates safe. I am a parent of Jefferson County students here, and I appreciate that you kept him safe and that you're going to continue to do that through the end of October. I urge you to continue to follow CDC guidance on masking requirements to keep our children safe, and I appreciate all that you've done. I know this has been hard. Thank you very much, and my husband joins me in saying thank you, so you can move on to the next person. Thank you, thank you, thank you, thank you.
Okay, Dale Nesbitt is up and Christine Snyder afterward.
I think Dale was her husband.
Dale was her husband, okay. Christine Snyder is up and Mia Humphreys on deck. Christine, can you hear us?
I can.
We can't see you, but we can hear you.
Okay, that's fine by me. I appreciate the chance to speak to you virtually. And I also wanted to thank you for the mask mandate. It's allowed me to send my third grader to school feeling like she will be safe during the day. I'm hopeful that vaccinations will be available to kids her age soon, and that will be, more peace of mind. But in the meantime, I'm so grateful for the mask mandate. I would urge you to, at your next meeting, vote to put the mask mandate in place for the whole school year. And if we get over the pandemic and masks aren't needed, you could always change that later. But not to have these arguments month after month when the science is clear that right now we do need masks. The COVID death rate is more than 4 times as high in the least vaccinated state. And West Virginia has the lowest vaccination rate in the country. So our COVID death rate is high, and more than 2,500 children were hospitalized with COVID just on September 10th. That's according to the U.S. Department of Health and Human Services. And many of those kids do not have pre-existing conditions, so children are at risk. And according to the CDC, at least 529 children have died from COVID-19. So I'm grateful for the mask mandate.
We need
Please
to hear the
extend it.
presentation.
Thank you.
Mia Humphreys is up. Diane Blust is on deck.
No, that's not.
Okay, we could not find Miss Humphreys. Diana Blust.
Hi, thank you for having us tonight, and thank you for allowing us to make public comment. My name is Diane Blust. This is my father, Ken Blust. We are residents of Jefferson County. We don't have any kids in school in Jefferson County, but I wanted to thank you very, very, very much for your decision tonight, your decision at the last meeting to require masks. Dr. Reedy talked about community consequences and community spread earlier. And my dad is a World War II vet. He spent, he spent 2 years of his young life ensuring the freedoms that we all have and that we all talk about today. If it weren't for people like Daddy and for my uncle, who flew missions over occupied France during World War II, we might very well be speaking German today. So I would urge everybody in the county, but particularly people who have a decision-making role, to think about people like my father, think about that community spread, keep him safe. We are doing everything to keep him safe. We rarely go out. We go to doctor's appointments, that's about it. We don't spend any money in Jefferson County because it's not safe to shop here or go to restaurants here for us right now. So I would like you to continue to keep that mask mandate in place. If Daddy has to go to the hospital, there may not be room for him. I may have to drive him to Loudoun County without an ambulance. He's done everything in his life to keep himself healthy. He walked half an hour a day to work for 15 years, half an hour a day back. He doesn't drink, he's not fat, but he has kidney disease. He's 95 years old. He has kidney disease and he has congestive heart failure. So please try to protect the people in Jefferson County. And I could not be happier that you put the mask mandate in place. Thank you so much.
Thank you. Kathy, you're down for us, correct? We have Dr. Catherine Figa, and on deck is Catherine Joswick. Dr.
Hi, all.
Figa.
Thanks for having me. We appreciate the opportunity to comment. I won't take long. Just wanted to thank the board for your continued efforts to keep our kids safe. And you've done an amazing job. It's super hard. We apologize as a community for making it so hard for you, but you've done a great job. You've minimized quarantine. I've only had, of my 2 kids, only one's been out on quarantine for not too long, and thank goodness was negative. So you all have done a great job, and we gratefully thank you. And fingers crossed, we will skate through all of this together, and I hope that we come out a more resilient and stronger community as a result. And also thanks to Dr. Reedy as well for all your service to our community. That's all. I really appreciate y'all, and please thank you for having the mask mandate in place. It's definitely an important part of keeping our kids in school. So looking forward to getting those vaccines. So take care. That's it.
Okay, Catherine Joswick and Jeff Santa Croce is on deck. Catherine Joswick. No. Jeff Santa Croce. And on deck we have Susan Wommeldorf. Jeff, can you hear us?
Yes, I can hear you. I didn't hear you say my name. Thank you again. I won't give you my full speech after you've already made the decision to implement the mask mandate and extend it through October. We really appreciate this decision. My wife and I are supportive of mask mandate and the fact that our county is observing the science and observing the data that supports, the effectiveness of masks and how they're helping our kids stay in school, which is beneficial to their growth as children and their education. Both of our kids were virtual learners last year, and we're so delighted that they're back in school, back with their friends, learning in person. So we want to keep it that way. Thank you for the mask mandate. continue to observe the data, the trends. Hopefully this peak of COVID cases in Jefferson County starts to plateau. We observe some changes and wait for the vaccinations for our kids. The kids under 12, hopefully soon will have that opportunity. So thank you again, and thank you for your service.
Thank you, Jeff. Susan Wommeldorf is up. And then in person on deck, we have Dan Fitzgerald. Susan, can you hear us?
Can you hear me now?
Yes, we can. Thank you.
You may hear some screaming in the background of a future Jefferson County public student, as well as the one who is a current student. I do want to also give an additional thanks on behalf of my family and my patients. I'm a family practice physician in the area, helping out some in urgent care, and we're just seeing a lot of kids who are sick. Luckily, not a lot on ventilators. I also want to echo maybe extending the mask mandate maybe up until Christmas. I think Christmas is going to be a rough time. We have to remember that not every kid will be able to be vaccinated immediately, and some parents will wait, and being able to protect kids who can't vaccinate immediately would be great, and giving us all some time. We are praying for the vaccine. We thank you for the COVID tracker. I thank you and Dr. Reedy and everyone getting some flack for doing your best to do the right thing, but I don't have to tell you about all the studies showing masks work, and I think they do not work when they are optional. They don't work when both parties aren't vaccinated. I'm sorry. They don't work as well when both parties are not masked. So thank you very much, and prayers to everyone that they can stay safe.
Thank you, Susan.
Oh, very last comment. Sorry, very last comment. Someone mentioned CO2 rising in masks. I get labs on people 5 to 10 times a day. The only people that I see raise CO2 on, carbon dioxide on, are patients with other problems. So I don't think that, and I've also read several studies showing that that's not happening due to the mask. There's a lot of misinformation out there, and we need to go to our physicians and our scientists who do that for a living. So thank you again.
Thank you, Dan Fitzgerald. And on deck is Karen Buck.
Right now?
After Karen.
Good evening. My name is Dan Fitzgerald. Some of you might know me as Sherry Fitzgerald's husband. Before I begin, I'd like to tell you a little bit about myself. I was a police officer for 29 years in Montgomery County, Maryland. 20 of those years, I was a detective. During my time as an officer, I worked many cases with federal and local jurisdictions throughout the metropolitan region. I investigated a broad range of criminal activity throughout my career and was successful in my mission because I understood people's motivations. During my last assignment with Montgomery County, I worked in the Vice Unit. A major part of my responsibilities was investigating criminal organizations involved in prostitution and human trafficking. Another responsibility of the office was public corruption. Although completely different crimes, in both types of investigations, people use their authority to manipulate and intimidate others to get what they want. It is in this vein that I'm here this evening. It appears that a member of this board has a personal vendetta against my wife and is using their position to undermine and attack her.
Be careful and.
All right. Tolerance of this type of activity brings disrepute upon this body, and in the long run might cost the board. Because of this, I watched your last meeting and saw a member of the board seem to be concerned about public being informed of the board's expenditures. I think that's a good idea. Why not create an easily accessible site to allow the public to view the cost of dealing with teachers' frivolous complaints, which drag the system through litigation? Even though grievances are public record, why should a citizen have to search on the internet for names? When a teacher attempts to avoid corrective action plans, takes paid leave, this is a cost overrun for the school. Not only is the school system paying for the disgruntled teacher, but has to pay for a substitute teacher. Add the cost of the legal fees to represent the school system, as well as lost time for any witnesses that have had to attend hearings, which may entail getting a substitute for them. The county also has to pay mileage, meals, possibly hotel for those testifying, and I assume an arbiter. In some cases, the grievances are taken to court and drag on for months, if not years. Depending on how far the teacher wants to push the case, this could be in the six-figure range. If several teachers are doing this, the cost would add up a lot. Also, at the last meeting, a board member raised a discussion about the repercussions for students missing school for 5 days. What's the repercussions for a teacher missing months? In these times, the board has a lot on their plate, and they shouldn't be using the press or social media
Finish up, please.
to mount a smear and slander campaign against an employee. Thank you.
Thank you. Karen Buck is up, and Joanne Curran is on deck.
Karen Buck, speaking of money. If the school doesn't follow the CDC Safe Schools opening protocols, they have to give back the $762 million to Joe Biden. So this is never about your health. This is about money, plain and simple. And excellent job on the fear-mongering tonight, guys. At the September 13th board meeting, I reported the following situations in Jefferson County and said it would get worse. Critical race theory, black math genius, the cruel masking of our children, the school vaccine competitions, possible vaccine clinics in our schools, counseling department failures, teachers and bus drivers quitting, questionable school budget entries, and pedophile teachers. Well, it has gotten worse. Since September the 13th, we've got Google Chromebooks with a camera feature. You parents know about that camera feature, right? School personnel responding to a Freedom of Information request by saying, "What the hell is this guy's problem?" Releasing employee social security numbers to a private individual, taxpayers having to buy identity theft protection, and a board of education employee publicly complaining about parents speaking out, telling parents to face some hard truths. This is the arrogance we're dealing with. Let's discuss Freedom of Information Act. It's called a FOIA, F-O-I-A. Anyone can request a FOIA information under FOIA. They have 5 days to respond. Just a note, the response is not supposed to be, "What the hell is this guy's problem?" A favorite trick of this board is to respond by sending hundreds of documents, totally unrelated to what you're asking. You're asking for this, they give you this, they give you this, they give you hundreds of documents, and you have to sift through it to piece together and look for your answer. It's called a document dump. This time their document dump trick backfired, and they released Social Security numbers of 1,200 employees, and now we, the taxpayers, have to foot the bill for identity theft protection for years. Wow. You do realize that identity theft protection is not 100% secure. You get that, right? This is a self-inflicted train wreck here. You people are out of control. And here's a hard truth. This board has the ability to turn all this mess around right now. Enough of the backroom deals, the incompetence, and the arrogance. Put our children first.
Yes.
Parents, I'm not done. Pull your kids out by October the 4th. Just say no to this mess and vote next May the 10th. Thank you.
Joanne Curran, and on deck is Brittany Crook.
Well, there are so many issues in our world, it's hard to pick one tonight, but the best place for regular folks to start is by improving their own family's small world, and that means the Board of Education. 82% of our local taxes go to education. As the saying goes, follow the money. For that amount, our students should be at the top rather than the bottom of the list. Where does all the money go? You can find out. It's all public if you dig. School is not what it used to be. They're teaching things you wouldn't believe, even in our own Jefferson County. Let me explain. You've probably heard the term being woke. It's a term used by Democrats or socialists, as they openly call themselves. They think they all woke up to seeing how much better life in America would be if the government ran everything. Because we've seen all through history how great life is under the rule of a leader with no constitution to follow, instead of being free like we are in this terrible country. It's no wonder that masses of Americans are trying to escape and make their way to better countries. We better hurry up and finish building that wall before too many people escape from here. Surely our world history classes have taught how great all the other socialist communist civilizations have been and how they flourish even to this day. They really are almost heaven, not here in miserable West Virginia. Freedom is so horrible. Did you ever have the vocabulary word irony in school? But this is partially our fault for sitting idly by while the Dem socialists invaded our teachers' colleges and then our schools. Shame on us. And we Americans must now wake ourselves up. SOS, save our students who are being taught things like critical race theory, which in its simplest form teaches races to distrust each other and keep to their own kind. Or the whole gender confusion being pushed on children when they really just want to be kids. Or the pornography fourth graders in nearby counties are reading. I do know there are books in our schools that children are not allowed to take home. Wonder why. Parents, if you don't think it's happening, ask your own children, ask your neighbors. Some parents said that the first week of school in their school was about feelings, answering questions how it would feel to be bullied or made fun of or embarrassed. Have you ever made anyone else feel bad or sad? Kids have lost so much academics after virtual school, and this is what the school thinks is the priority? Really? Tonight, though, I can't put the 20th anniversary of 9/11 out of my mind. What were our children taught about this just a few weeks ago? Not much, apparently, since they were busy talking about their feelings. I watched plenty of news about that horrible day and the 20 years following. One reporter asked college students whose only resource for learning about 9/11 was in school. Most said they had very little coverage of it. Even fewer knew the players who attacked, where, why, and what the great first responders did. They mostly spit out cutesy woke words like how we should just understand each other and not judge. Do they even know why we take our shoes off at airports or only bring 3 ounces of liquids or go through scanners? I bet not. Poor prep for real adulthood, disturbing on all levels. I have mistakenly assumed we were safe from this nonsense in West Virginia, but I was wrong, asleep and assuming. And you know what happens when you assume. And then I woke up.
Brittany Crook and Dr. Chris Pease is on deck.
It's Crocker.
Crocker, I'm sorry.
That's all right. Hi, my name is Brittany Crocker. I wanted to address the board, I guess now since the mask mandate has been put in place. I want to know if you guys are going to follow West Virginia State Policy Title Series 106-025A on standards for basic and specialized health care that went into effect on July 1st, 2021. Article 310 states health assessment, process by which the certified school RN obtains students' health data. The assessment is comprehensive, systematic, and continuous to allow the certified school RN to make a nursing diagnosis and plan for interventions with the student, family, school staff, and licensed prescriber. Article 311, Healthcare Plan. Written documents developed by the certified school RN, which included a nursing diagnosis, is individualized to the student's health needs and consists of special goals and interventions to, delegating in the school nurse's actions, delegating procedures, and students' role in self-care. Article 328, stock medication. Medication purchased by the school system under the authorization of licensed prescriber with medical standing protocols and procedures for administrations to students, staff, and other persons as allowed by code and policies, such as opioid antagonists and epinephrine. Are the schools providing masks during the school time, and are they constantly being swapped out for dirty ones? No. Article 5.1, for students needing specialized health care procedures, the certified school RN shall access the student's review the license, prescribed orders, assure implementation of needed health and safety procedures. This assessment shall be completed before initial school attendance, following any attendance during which the health condition may have changed, necessitating reevaluation. Do we have enough nurses to access each student for masks because they are specialized healthcare procedures? All students receiving special health care procedures during the school day and school-related events shall require a health care plan. Do we have health care plans for all the students because of the mask mandate? Article 7.5. The certified school RN must develop monitoring systems with appropriate timeframes to ensure safety and effective monitoring of the assignment and delegation of all basic and or specialized healthcare procedures. Do we have a plan on how to monitor the students for their safety? Article 8.2. An individual record table will be made for each student needing a specialized healthcare procedure. It will include the date and time of the procedure was performed, any notes or events and or interactions, and the person's signature supervising the procedure. I would like to note, if you look at OSHA.gov, they say the definition of a face mask is any surgical, medical procedure, dental, or isolation mask. Also, if you check out portal.ct.gov, they give some examples of specialized healthcare procedures such as asthma, allergies, oxygen therapy, and pulse oximetry, whatever. All of which can be amplified by wearing a mask. My questions to the Board of Ed. What plan do you have in place to accommodate these policies stated above for the specialized healthcare procedures for all the kids?
Dr. Chris Spees, it says here that he may be in person or may be on Zoom. Jason, can you look for him on Zoom, please? Jennifer Cross is on deck. Dr. Spees, can you hear us?
Sorry, can you guys hear me?
Yes.
All right, there we are, good. Okay. So sorry I couldn't be there in person. I'm currently working. So for those that don't know, Dr. Spees, I'm a practicing physician here in the Eastern Panhandle, where I've been for the past 9 years. Last time I addressed the board last month, just to let you know, both of my kids attend Jefferson County Public Schools. They've done so their entire academic careers. And the views that I state tonight are mine and my own. Because apparently they're not popular. First time for every eligible adult to receive the vaccine is the single best mitigation tool for stopping the spread of severe illness with COVID-19. Following my comments after last month's meeting, I received many other comments from fellow community members questioning my integrity, my intelligence, my parenting, my ability to practice safe medicine. I received threatening phone calls to my place of business promising legal action against my medical license, as well as phone calls from potential patients who are refusing my care. While I understand that school mask mandates are a very sensitive subject, I think we all need to remember that in the end, we're all fellow community members and concerned parents. And even though our opinions may differ, we should have the right to express them without fear of retribution. However, I will never play the victim, and I'll never cease advocating for what I believe is best for my children, no matter what the consequences are. Following the institution of the school mask mandate on August 20th, most COVID metrics continue to worsen in our county, and only in recent days it appeared that we perhaps reached a peak, both county and statewide. So after 5 weeks of mask mandate enforcement, they appear to have accomplished nothing. Cases and hospitalizations of vulnerable populations, particularly older, unvaccinated individuals, continue to rise over that period despite the mitigation efforts. All we truly accomplished was perhaps making ourselves feel a bit better by forcing masking of our least vulnerable population. Deaths involving COVID-19 is the only single metric that any of us truly care about. Since the beginning of the pandemic, deaths among those aged less than 16 years of age in West Virginia remains at 0. Deaths among those aged less than 30 years of age, 13. Deaths among those over age 50, 3,346 in our state. Nationwide, according to the most recent CDC provisional counts, there have been 464 COVID-involved deaths among children aged 17 and under. Keep in mind that this demographic represents over 73 million Americans. In that same time period, the CDC reports 856 deaths from non-COVID pneumonia in that same age group, nearly twice the number of deaths compared to COVID-19. When compared to the estimated 1,282 child deaths during the swine flu pandemic of 2009-2010, pediatric COVID-19 illness is 5 times less deadly than the swine flu. Yet during the swine flu, there were no moves for distance learning, whole class quarantines, or mask mandates. And whole classes are still being quarantined for one positive test despite the mask mandate. Children are continuing to miss in-person instruction, the exact opposite stated goal of the Board of Education and the superintendent when the initial mask mandate was implemented. Based on your vote tonight, the Board of Education continues to deny science and peddle in fear, teaching our children that their friends are sick, that the air they breathe is toxic, and that the very adults they are supposed to be acting in their best interest instead act out of political expediency and virtue signaling. Thank you for your time.
Danner is on deck.
Good evening. My name is Jennifer Kraus. I'm the mother of 5 children, 3 in Jefferson County Public Schools currently. To the parent who suggested that those of us who don't want to send our children to school wearing masks should go ahead and feel okay to keep them at home, thank you, but no thank you. Dr. Reedy wanted time to look at the COVID data. From August 23rd, first day of school, to September 27th, today, the total deaths in West Virginia of people with COVID is 361 statewide. Jefferson County deaths, 12. The age breakdowns on those Jefferson County deaths: ages 0 to 50, 0. Ages 51 to 70, 4. 71 and up, 8. If masks work, why aren't they working? Dr. Reedy did not speak on behalf of the county health department. He does not speak on behalf of the county health department. The health department made that fact crystal clear shortly after the school board meeting. The health department states that the masking decision should be left to the parents. Why are you still pretending that he speaks for our health department when he does not? Why are you forcing this on our children? I'm sorry, I'm incensed, I'm furious. Why are you so insistent on keeping parents out of the schools? I think I know why. Why are you sending home entire classes of children, denying them their right to an education when they're not sick? If anyone is still worried about the virus, go get your vaccine. You can get it anywhere. It is time, no, it is past time to get off this endless highway of mandates and controls. Where is the exit ramp to normal, please? Normal means no forced masking. Kids are sick and tired of this nonsense. They want to see their friends' smiling faces. They want to laugh and play and learn. How can they learn when they can't hear their teachers' voices? Their teachers' voices are muffled like this. Normal means let parents back into schools. End your ridiculous mandate tonight. Excuse me, I thought we had the chance to say something before you voted. I thought you were listening to us. Silly me.
Excuse me.
Excuse me, I'm talking.
Right. but
And
there's
to
too much
those
talking out
parents
here.
who want to mask themselves and their children, you have that right. Send your child to school with a mask. But do not think for 1 minute that you have any business telling me what is best for my children. Forcing children to wear face diapers is unsanitary and it's dehumanizing. Yes, it is. To you parents, I feel for you. If you're that concerned to send your child back to school where most of the people are breathing fresh air, please feel free to keep your child at home.
Dana Danner and Danielle Wine
They don't care.
is on deck.
All right, well, I feel a bit selfish because I'm not speaking for everybody. I'm speaking for my daughter and her class today. My child goes to Blue Ridge Elementary and she does not have a teacher. She has not had a teacher since the beginning of the school year. They knew before the school started that she was not going to have her teacher all year. We were told by the last minute 2 teachers that had to come do meet the teacher night last minute because they had nothing to do with the class, that they were not, oh, we assure you we're going to get somebody. This is Thursday night before school starts. She still does not have a teacher. She had a sub. It's been horrible. It's complete anarchy. I can't even, the children are getting hurt. The children are not learning. My child comes home every day. I say, how's your day? It was chaotic. It was a mess. Have a good day at school today, honey. How am I going to do that? It's a crazy mess. I couldn't finish my lunch today, Mom, because the kids were so bad we were late to lunch. She doesn't have a teacher. They did remove the teacher that was not handling things. We do not have a teacher. My child's test scores came home the other day from last year. She's behind. She was virtual last year. We've had 5 weeks of school, and she has not learned anything. She's going to fall farther behind. I have already talked to the principal about moving her, but that doesn't help all the other children in that class. I wrote an email last Friday to some members of the board. I have not received a response.
Never do.
My understanding is hearsay. My understanding is that there is a full-time teacher being paid for this position. They have no intention of bringing her back. She was not so great, apparently. But they're keeping her on the books, which is denying my child a full-time teacher. No one is going to come in there for full-time pay for full-time work without full-time pay. It's not fair to that teacher to ask her to do that. So now my child is just in limbo with no teacher, behind from virtual, and no response from the board.
Danielle Vaughn is up. Judy Ingbert is on deck.
Hi, I'm Danielle Byrne. I am a parent of a student that goes to Blue Ridge Elementary, the same 4th grade class that Dana was just speaking of. But my child was hurt. He was hurt by another student because this class doesn't have a teacher. There is no constant, there is no structure, there is no nothing to this class. You know what the student was told that hurt my child? With a pair of scissors, cut him, because she was turned around like this, cutting at his desk, had no reason to be doing so. That's not okay. To me, as a parent, that's not okay. That is not whatsoever one bit okay. I came here to the board and I was told to speak with someone that I don't really feel like has much say. Something needs to be done. I am removing my child from that class because it's not a good place in there. The kids' safety is at risk. Like I said, there's no structure. The principal herself doesn't even have control of the situation. Something has to be done though for these other kids. My child will be moved, but that's not to say what's going on for the rest of those kids. These kids are behind because of virtual or in school, being put on quarantine, what have you. They're behind. The teachers, my kid comes home and tells me, I've only learned 3 things this year. 3 things, and we've been in school, this is the 6th week of school now? That's not okay. And if I can see it with my child, I know darn well that all of those other children are experiencing the same thing. Now, as Dana had said, I know it's to do with the teacher that is being on the roster, that she is the teacher. But that is not fair to these kids. These kids deserve an education. Do they deserve to get further behind? No, they don't. This is Jefferson County Schools, and they need to do something. You need to do something. Do better for our kids. The masks, they don't work, but either way, here nor there, we need to be better for our kids. We are 2 parents out of that classroom that come here tonight. I can only imagine what the other kids are going through. But my son was 1 child out of, I know for a fact, 6 to 7 students that have been hurt in there. That's not okay. That's not okay. And substitutes are, when we get a different substitute, the work that they're doing, they're just checking the work. They're not making sure that it's correct. I know for a fact that some of the work that was actually written incorrectly, but it was checked. So I guess we're just getting participation grades in 4th grade. No, that's not okay. We need to find a teacher, and we need to find one ASAP for these kids. Thank you.
Judy Ingbert and Barb Fuller is on deck.
I want to thank you for the opportunity to speak tonight. With the teacher shortage increasing, I want to share some items that might attract new teachers besides high salaries. Teachers, like all employees, like to work in a non-hostile work environment. Teachers need a safe place to share their concerns without the fear of retaliation for reporting misdeeds of fellow staff members. Teachers want the right to not be touched by the fellow staff members. Excuse me. Teachers want the right not to be touched by fellow staff members, especially the supervisors. Teachers want the right to not to be verbally shamed and or intimidated by the staff, especially supervisors. Teachers want to see the records of how school funding is spent to keep the staff from tampering with evidence of misdeeds by keeping access to the evidence from others who want to protect their friends, or from their consequences. for their actions. There should be financial records kept to the staff for treating false evidence, especially false evaluations. Teachers want to find the following qualifications appreciated in the staff members: honesty, integrity, cooperation, to work as a team to educate the students. Teachers want fellow teachers who are capable to teach the subject matter that the students need to learn. Hiring qualified teachers as permanent staff ensures salary and benefits and consistency of staff. The main goal as teachers is to teach students to be problem solvers, not to seek to be friends with a bully to resolve problems. You have 2 people working in this school district who practice racketeering hiring. This compels a teacher to stay or to leave the school district. Laura Sutton and Amy Loring are these 2 people.
You cannot use names.
They've used a lot of things against me.
Bingo, honey. Barb Fuller.
Yep. Your social security number.
Hi, my name is Barbara Fuller, and we keep on hearing that we desperately need teachers, subs, and bus drivers. How can we fulfill these positions when these people don't want to work here? They do not feel like they are respected. It's sad. Support personnel in particular think that they are treated as second-class citizens. Even those who do apply are finding out that they're being turned away from Jefferson and Berkeley counties because, well, maybe it's because the human resources from both counties have been communicating amongst themselves, blacklisting qualified teachers. Just one of the things that I've heard this past week, as my ears are bleeding every single day. Many associated with our schools resent the fact that this board continues to create high-paying administrative positions and giving raises instead of taking care of our teachers and our service personnel. Because our teachers and our service personnel are really what keep this county going, not our board office.
Yeah, thank you.
Why do we have outside counsel when one is provided by the county? I don't know, that $160,000 salary could be put towards classrooms, go figure. It could go towards supplies for our children. How about we get rid of a lawyer hired by you guys and fill it with someone who won't disrespect public citizens? Because we all know what is this guy's problem. Thanks.
Okay, next we go into the consent agenda. Is there a motion to approve the consent agenda?
I was supposed to speak, I didn't get my name called. I had signed up last week.
Okay.
What's your name? Samantha Archer. I had signed up last week. I emailed in, cause Ms. Skinner
Yes.
sent me a link.
Well, and I told you needed, I did have your name that you had called, but you needed.
I messaged you back and told you I would be here and I would like to
But
speak.
you did not sign up, that's.
I couldn't get to you. I was here and signed up.
What the?
We were here. We were here.
No. You, I do have your name as emailing me, yes.
Can she speak?
But I think I'd also told you needed to be here to sign up in person.
I was here.
She was here.
I was here the whole time. I've been back here the whole time. No one said anything to me. You said
You're
that
wasting
being here
time.
by
She could
6:15.
be talking. Let her have her speak.
You may go ahead and speak.
Thank you.
My name is Samantha. I'm here simply, well, you guys already made your decision that you are going to keep the mask mandates in place. Fine and dandy. But here's the thing you need to know. These masks are a germ playhouse for these kids. They collect bacteria. All the things y'all are saying it protects us from is droplets. Droplets that get caught in these masks that these kids are putting on their face 24/7, putting the spit that's coming off their mouths right back up on their face. It's disgusting. I've seen kids literally sneeze in these masks and have to wear them all day long.
Oh, no, they're
It is horrible to put them through that. Y'all want to talk about protecting them from COVID? Well, these masks are making their immune systems weaker. It's making it harder for them to breathe. My kids come home with migraines 24/7. I know children that come home with nosebleeds all the time from wearing them all damn day. All day, excuse me. It's ridiculous. Okay? Not to mention, when you're wearing this, who are you behind the mask? The kids can't see. They don't get their individuality. They don't get to be the person that they want to grow up to be. They have to be a person with a mask on. It's ridiculous. Not to mention, how are kindergartners supposed to learn? Your teachers are talking like this. You can't hear them. You can't see their mouth. They can't learn their ABCs. They can't pull it down to say, hey guys, this is how you properly say a letter. It's ridiculous. Their test scores are dropping because of these masks. If they worked so well last year when you had them in place, all year, inside, outside, lunchtime, everything, they were eating in their classrooms, why was COVID still going around? Why was it getting worse? These masks are not doing anything for our children, and you made the wrong decision. And honestly, when you have kids that are sitting there, literally straight A students, crying, they don't want to go back to school, that's a problem. My kids were straight A students all their life. The whole entire elementary year, they have been straight A students. They're amazing, smart, brilliant children. My daughter is suffering in her grades because in the test scores I got back from last year, she was in person for half the year. This is the lowest they have ever been. She's barely passed. And it's because she couldn't focus. She was having migraines left and right. And when I bring this up to the board and say I would like to get a medical exemption, I'm told it won't matter anyways because y'all won't accept it. That's not right to me. You guys are not doctors. You are not nurses. You don't take care of these kids when they're sick. We do. We as parents do. And all you're doing is hurting them more. It breaks my heart that we have people like you guys behind the desk not caring what us parents have to say when we're the ones paying for y'all.
Right.
Yes.
You put all your faith in Dr. Reedy?
Excuse me, order.
Yeah.
Yes, ma'am.
Yes, hi, I'm Tracy Cox. I was here. I did not sign up with you. I sent an email. Well, actually, and I spoke to someone to speak. So, again, if I would be given a couple seconds, my son attends Jefferson County Schools. He also, I did call to ask if he could speak as well. But it's the same situation. If parents would want their children to wear masks, they should be able to be given that option. The school board, again, we listened to Dr. Reedy and he gave his science, and then there was another doctor who gave science. If we're trusting the science and going by what parents want for their kids, let the parents decide what their children should do, because those are the people who, again, like that mom said, we have to take care of them. We have to take care of them when they do get sick. The bacteria that grows in these masks from food, spit, and everything else, saliva, not washing them. How many parents are properly caring for the mask? How many teachers are telling the kids to renew after lunch hour? So when you decide before the parents get to speak, that's just rude, and it's uncaring, and it's very hurtful to me. I definitely would love to take my kid out of school. I work full time, and I wanted him to be in the school system here. So now it's very hard for me to decide to keep him here because you guys don't have his best interests at heart. I don't want any of my kids to be taught or managed by a board who doesn't care about him. It should be up to the parents. That's what the health board said. Let the parents decide. Let the parents decide. Let the parents decide. If you want your children to wear a mask, send them with a mask. If you want your child to be vaccinated, let them get vaccinated. I don't want my kid to get jabbed. I don't. And I can tell you why. I have friends who were sick from getting vaccinated. We've had COVID. We did. And we do believe in natural immunity. We do believe that if we do catch it, if it's going to happen, it's going to happen. We do believe that people who want to keep their families home and keep them hidden and scared and be raised that way, that's what they decide to do with their children. But having us breathe this in all day, spitting in this thing, it's not good for you all. I feel for you all. You're sitting there, you're halfway asleep. Then you have people here, and it's hurtful. And again, so to me, I am hurt as a parent that you didn't listen to us prior to voting and the unanimous decision to say aye before we even had a chance to speak. That is not considerate of what we pay for. We pay to have our voices heard. Yes, there are parents who want their kids in masks. Put your kids in masks. Send them in 7 masks if you want. I don't want my child in not 1 mask because he doesn't like it. And he can tell you for himself what it feels like. His name is Jackson Cox.
I was gonna say, but what if you sneeze in the mask and there's snot and you're sick? You're still going to get yourself sick even longer. So
And
what's the point of wearing it?
He's 8.
An 8-year-old knows this.
He does. He's smart. Trust me, people. I love my child to death. I'm never going to do anything to hurt him. Trust me. And if I believe that him wearing a mask would save his life, I would make him wear it every day, but it's not.
No.
He's still going to catch COVID. Even the vaccine. My girlfriend, she had COVID, and against her better judgment, she got the vaccine. And as she was sicker than what she was when she had COVID, she wrote her children notes. Don't let anybody force you to get this vaccine, because it's not going to save your life. Take care of yourself. Teach these kids to exercise, eat properly, do what you have to do to take care of yourself. This mask is not going to save your life. The vaccine ain't going to save your life. Eat properly.
Okay, we're moving to the consent agenda. Is there a motion to approve the consent agenda?
So moved.
Second?
What are we consenting?
Second.
Time that they skip?
Discussion?
Oh, yeah, I have some questions. 18 position creation, position change. Can somebody explain that? Can you explain that?
The number 18.
Yeah.
Before I address that, I did want to let you know that on line 17, there is a deletion. That individual has rescinded the transfer from the current position to a new position, so there's a deletion. Number 18, I'm going to combine 18 and 19 as well as 23 because those are all 3 of the same ideas and concepts. So due to an increase of demands and department needs, we have a number of service categorized employees that are conducting more and more professional level duties. It's a position change because it's not an additional position to the central office. It's changing the secretary role to a human resources assistant and then one for an attendance assistant due to the level of performance responsibilities that they are taking care of. There's also no extension to the contract days. They still remain 261 days. For 23, the secretary 3 to the secretary 3, accountant 3. That again, the position already exists. We are just needing to change the position title and the level of position. Pupil services is also more or less special education, and they have a $20+ million budget that department is responsible for overseeing, and with one secretary in that department, accounting duties are absolutely essential for that position. And in order to perform that level of secretarial positions, the accounting designation has to be added to it so that it's not out of classification. So with classification, it also affects 18 and 19 as well, because if we are unable to reclass them through this process, we would have to go through the reclassification process and bring it back to you for legal reasons. So therefore, the positions already are in existence. We're just asking to change them to reflect the level of responsibilities and oversight that these positions are responsible for.
Is it accurate to say that the people in at least 2 of these are already doing the work? And
That's correct.
that they're just going to get paid for it now?
That's correct, yeah.
These
They're
are
out of classification.
promotions for service personnel.
Correct. Yep, and it's part of the career service
Okay.
letter that we pitched as well, and got the feedback from the staff that it's something that they support. So they are operating out of classification right now. So once we reclass them into these roles, then the position would then, that they currently hold, would be eliminated, and we wouldn't backfill those.
So then 24, I don't understand that. I just feel like we recreated that, or Dr. Gibson created that position back in the spring for director. And why do you need now a coordinator? And also, I just feel like personally, I don't know anything about the virtual. I've asked to see the virtual to get an idea. How many students are, being served virtually? So those are some of my questions.
Yeah, and just to answer the first part, and then Dave's going to come in and talk to the specific questions about the program. We do have the director position, and that position oversees CTE, virtual learning, option pathways. There's several alternative programs that this position oversees. With the bringing on of the virtual program, which is a completely separate entity, it was always our understanding and need, and part of the discussions earlier, that there would be somebody who would need to have more of a focused oversight on that specific JVA program. However, wanted to see how everything went with the JVA program to see if that was going to be needed or not. And due to the volume of enrollment, it is necessary to add some additional supports in order to help with the success of it.
So what is the unit, or he's gonna say?
Yeah, just a little bit of background. So JVA currently has 400 students and 43 teachers. There are
only 400 students? Is that what you said?
400 students.
So it's about the size of a large elementary school?
Yes. So 2 of those positions that were originally in the budget for JVA, one of them was actually called principal, and one is a counselor. Neither of those positions have been filled. The reason for the principal vacancy at this point is that we wanted to see what was needed. We wanted to give it time for the school year to start to see what was needed. And so this position is going to not just work with JVA, but all virtual learning. And what's going on is that there's a lot of students coming in and out, not of JVA, which is full, but of virtual learning. So parents are opting to go virtual, and then some parents are coming back from virtual into the school building, and it's definitely a lot to manage. There are also, our SOMO department has been working a lot with those requests, because many of those are medical requests to be either virtual or go back to the school. This particular person is also going to be a point person for if we do go completely virtual, to make sure that things are working the way they should be. I can tell you that right now, as students quarantine, there's a need to make sure that devices and instruction continues to move forward, and so that person can help bridge the gap between the schools and the central office, and as well as being a link between JVA and the technology department. So there's a variety of virtual students. There's JVA, there's students that are on Odyssey-ware. Those are families that really did not want to send their children to school due to COVID, and so we've been working with them, and they're on Odyssey-ware. There are homebound students, there are homeschool students, so there's a lot of students that are taking advantage of virtual instruction. So after considering all that, we wanted to bring to you a virtual learning coordinator.
So you
position.
haven't filled the principal and counselor. Does that mean
in lieu of the principal position, we're asking for a virtual learning coordinator.
But this, it just seems like the person that was in that previous position, the whole idea was, well, we're gonna just add this and now name it director. So the whole idea was to give more pay, was because there was more responsibility. Now you're coming back after just a couple of minutes and saying, okay, well, now there's less responsibilities. So why is this director? I don't understand that.
Those positions were already included in the JVA budget when the program was developed. It's not anything that's above and beyond what was already included.
This coordinator wasn't.
Okay, so the principal position that was in the budget, what we wanted to do was look at what was needed in the program, not just JVA, but virtual learning. So after we took a look at a comprehensive look, we feel like it needs to be a virtual coordinator and not a principal.
I understand that. Is it possible to get a presentation about actually what this virtual school is all about? Because I have tried to look myself, and I'm waiting for a response from Dr. Gibson as to whether I can look at one of these, not while kids are there or look at anybody's names, but to get an idea, are these live classes that are being taught, or are they virtual? Because they're, often there's positions that we're approving for these adjunct virtual teachers, but then I'm told they teach at night. So I know the kids aren't there. So is this asynchronous, and you have 43 teachers for
It
the
is a
40?
mix of synchronous and asynchronous learning. Primarily at the elementary level, it's synchronous. Primarily at the secondary level, it's asynchronous.
I personally feel that without knowing more about this virtual and how it works, and given the fact that we keep adding more positions.
We're not adding positions. This one was
Yeah,
already included
I
in the budget.
understand, but I just, it's, for me personally, I'm uncomfortable with that. And why is it that we haven't really had any information about the virtual?
About
The virtual program, like how it works and.
about JVA?
Yeah.
Yeah. I thought you had a presentation, but we could certainly put another one
Yeah,
together.
I don't have an idea of how it works, really.
Okay.
I mean, you're telling me now that it's a mixture of asynchronous and
Sure.
synchronous. And
When I come back and do my presentation, I'll be glad to just focus on JVA and
I
what it's all
would
about.
like to make a motion to pull position 24 until we get more information about that position.
There's a motion on the table right now.
Oh,
You need to vote it up or down, and then you can make a motion.
okay.
Unless someone would like to make an amendment to their motion.
I can't hear what you're saying.
Would you like to amend your motion to pull the position off for the virtual coordinator?
Number
or leave-
24.
Or leave your motion on the floor as is?
No, I think we'll leave it like it is.
Okay, we need to vote on the motion as is at this time. And the motion is to
I
take the
have
consent.
other questions besides
go
that.
ahead. Go
Yeah.
ahead.
So that's for the finance, Ms. Maroney is here. I just thought, well, since you're here, maybe you could answer this, because I keep kind of asking about this and it's not clear about, maybe you can explain better so that the public understands. This other column, why can't the public know more about specific expenses, like what certain expenses are? Is it for textbooks, or is it for, whatever, bread?
You're talking about the vendor and description. Oh, sorry.
I will do my best. So you're talking about when we post up the purchase orders and the checks that are written and the data that is extracted from the financial system to put on the public agenda?
Yeah, so that the public can see, to have an idea, because there's a name, and Liz Skinner said they could Google that, and even though I've Googled, I still don't know what some of the expenses are.
And I understand, I've been here 16 years and I know the numbers and can translate that. What I will say is tonight I also have, a newspaper publication, and 2 years ago the State Department did require that all of our expenditures down to every detailed level is posted. So tonight, part of the packet is in the newspaper on an annual basis. Any expenditure that is greater than $250 is listed by that vendor. But you are correct in saying that if you see Walmart and it doesn't say supplies, you may not be able to, that might not be a good example, but to connect those two dots. What is difficult is that those descriptions are on there, but we have a $150 million budget, and we have so many people that have input into that budget. Those descriptions would vary. They may create, inconsistencies and a lot of questions, but it is completely transparent data. And if you can't get that information, you're always able to ask that question and get an answer. And if you don't, you should.
and I know it's a little less
See,
convenient.
this is for the public. I mean, I just feel like it would make sense if the public could see what some of this means. Like, you know, I get
If you could give me
questions
an
all the time.
example, I mean, I understand, because there are descriptions on there, and the invoices typically do give some indication of it.
Well, I mean, I asked you for some,
I did respond to you this
oh
morning.
yeah, I'm just using that as an example. Yeah, you responded, quickly, and I don't remember which ones they are, because I have gotten 500 emails today about the masks. Superior Industry.
Correct.
So that-
And I only know because I've been here for a long time, but I do know what Superior Industries is, and I do know that we send our mops as the most efficient way for using public funds. We do send our mops to be laundered and cleaned and then returned to the schools.
No, I know what it is because
Yeah.
you told me. I'm just saying that's.
I agree. I
And
mean,
this, the city of Ranson. So people see that. What on earth are we paying the city of Ranson
I know.
for?
I don't know the solution. I do know that the state auditor did mandate that all of those expenditures are now also posted on the public website.
Regularly or just once a year?
Once a year, annually, because understand, tonight I'm gonna present unaudited financial statements that will then become audited financial statements.
Right.
And we don't wanna post them before an auditor has
And what's the
vetted,
point?
verified, and make sure that we're legally expending those funds in an appropriate way.
What's the point of presenting unaudited?
So that you know that this is my representation of ethically and budget to actuals and how the financials going down to a deep dive and level of detail are presented. And then we have an expert who then comes in, looks at that data, looks at the internal controls that we have in place, and basically give us a grade on those. And also in that period, that's their opportunity, if there would be a mistake or an error or something that it didn't meet a threshold, or GASB, which is Governmental Accounting Standards Boards, if I didn't meet that, then the auditor would consult with me. They would give us.
I don't mean to get off track. 'Cause we're on
Yeah,
the
well, they would
consent
give you an
agenda.
opinion, they would come back to you and say, we've reviewed your audited financial statements, we are either gonna give you a clean bill of health, or we're gonna give you a qualified opinion, or a management comment, which would then be your opportunity to come back to me and say, I don't like how we're doing the finances, and we need to change the things that the auditors recommended.
I'll ask you about that when it comes to.
Okay.
I'm sorry to distract.
Yeah, and I
you.
mean, I will strategize with you and meet, as far as transparency, I grew up here, went to Blue Ridge, went to Harper's Ferry, graduated from Jefferson, invested in this county as much as anybody else, and I want it to be transparent because I want our community to understand that I do take seriously and ethically the expenditures that are in the system to the
And
best
I'm
of my
not
knowledge.
suggesting that you don't. I'm just trying to see why it's so difficult to get that. And
Yeah.
maybe just explain what the codes are. Is that possible to
Easy.
share? with the
There's a chart of
public?
accounts. I can very easily give you that, give you even a presentation one-on-one with you and I.
No,
I
I'm
know
just
when-
saying for the
not by the
public.
vendor, but when you tell me the account code, for example, Superior Industries, I know 126 is a maintenance department, and I know a 61 object code is supplies for maintenance. And I normally look at that number and know it, but I've done it for a long time. It's not easy. I transitioned from outside of the school system. It is complicated, but it is really transparent. It may have to cross-map those data systems. We are a little behind in technology and making sure that all of our systems talk to each other. But we are doing the best that we can in that area.
So is it possible to list those codes for the public?
Absolutely.
61 is supply maintenance. That would help a lot.
Actually, we could put that at the front of everything that we post prior to the purchase orders and prior to the checks, just like a cheat sheet, basically. And that would at least help them understand one more step before they have to ask the question. I think it's a good suggestion.
I don't know if you need a motion for that or anything.
I don't think so.
Comments,
Unless
anything
Dr.
else?
No, thank you.
Laurie or Gary, any other questions?
Hmm?
Any questions?
No.
Okay, the motion on the table and second is to approve the consent agenda as presented with the deletion of number 17. All in favor say aye.
Aye.
Opposed, no.
No.
Motion carries. There is no unfinished business, new business. Fiscal year 2021 unaudited financial statement presentation.
It'll take me just a second to get organized. And,
This is the kind of community use in the restroom. Ms. Barone, is this a good time for me to use the restroom or?
Jason's gonna have to help.
Can we take just a moment, Beth? Yeah, Beth, can you take a moment? We need a restroom break.
Pardon me?
We need a restroom break. Can we take a
Oh,
moment?
yeah, absolutely. This is a great time for it.
Thank you.
And just so everyone knows, I did practice before I came. And with the Zoom and the video, it is actually my challenge here. But as we're waiting, I wanted to let everyone know that if they're interested, here's a copy of the financial statements, the PowerPoint presentation. It doesn't have the current logo on it. Yeah, it's coming. In addition, I've also, this is published in our newspaper on an annual basis. I've also made a copy of pieces of financial statements and every expenditure for the annual.
You guys want one?
See, you made it up quickly. She done it. We haven't gone anywhere. There you go. You're up there now.
Just let me know when you're want me to start next.
Do we need Janet here?
I'll get her. Go ahead. You want me to start?
Yeah, go ahead and start now.
Okay. Good evening, board members, public. Tonight I am here to give a presentation on our unaudited financial statements, and which is the second favorite time of the year. The budget is my first favorite time. And since I've never had more than one person in the audience, I'll give a little bit more of an overview than what I normally do. Currently in fiscal year 22, we have 7 funds, and most of our funds have designations. We have special revenue funding, that is our title programs and our special education programs and any federally funded programs that reside there. This year we added our ESSERF, or what some people refer to as the COVID or CARES funding. That is now in Fund 71 and has a special designation. We have Fund 51, which accommodates construction, typically local, but this year we have a grant, 2 grants from the SBA, one to update TA Lowry's HVAC system, and the other to help support the 2 new school builds that we will have. We also have Fund 31, which is a bond and bond construction money, which the public generously approved $47 million to help with the facilities in our school system. All of those funds are self-balancing funds, and when I say self-balancing, what I mean is that revenue equals the project expenditures that we are using. And with that said, tonight's presentation, the audit and the audit paperwork does have those funds in it, but the focus is on our general operating fund, which is primarily where we fund our school system's general operating expenses, most of our teachers' salaries, our supplies, and anything else that we have in a school system. With that, I am going to review revenue and then expenditures, and then talk a little bit about what we have when we finish up the end of the year and close it out, and what we are projecting to have as a carryover, and then how we expect to use that carryover carrying forward to fiscal year 22. Revenue, I'm going to just give you some highlights. I'm not really going to read it to you, but basically our revenue projections came in at $1.5 million over what was expected, and 1.44% to the total actual budget. Our taxes came in at $594,000 in total net collections to the school system. That is about $200,000 higher than what we have seen over the past 2 years. Typically, we collect about $300,000 greater than what we expect. The one thing I want to highlight to the board is the property taxes and how this presentation splits out current year and all other collections. I want to make sure that you understand that in a school system, some people do pay their taxes on time and some people pay them late. And when we budget that everybody will pay their taxes in the current year, and sometimes that falls short. When you see the negative $335,000, means some people didn't pay their taxes by the deadline or when we closed out our fiscal year. However, all other collections includes people who pay them at a later date. So sometimes if you have to make choices, your property taxes might not be the first thing you pay. So instead of paying it in the current year that it's due, you might pay it next year. What that does for us is it allows us to collect those back taxes and hopefully break even on what the collections are. And surprisingly, even in a pandemic, most of our community are still paying their taxes at some level. Investment earnings are up slightly, primarily not from interest rates because they are down. However, we did have a $47 million bond construction that was done on a premium. Those funds were deposited at the state treasurer's office in May after we closed on that bond, therefore providing some additional interest to our school system and drawing on those funds. The one thing I do want to mention is, just as a note, on the revenue from state sources, our school aid formula is how we receive a good portion of our funding. It's a 10-step formula to determine how we receive that funding. And also this year we have, I think, 4 retirement systems. Our TDC, which is our retirement 2 system, total defined contribution system, had a full reconciliation, and it was returned to the school system $900,000. So that is factored into that additional 1.5 million. And what they did is, in our school system, when you work, you have to, at the time that the plan was implemented, you had to have 5 years invested in the school system before you would mature and we would have that contribution. If you separate from employment prior to that time frame, we still, as the employer, had contributed that match. You're allowed to take your funds that you contributed, but periodically they'll do what they call a clean sweep and evaluate any of the funds that the county contributed and return those funds to us, and so we will not have retirements associated with them. Other than that, at the bottom is fund transfers. The school system, which when I came I was not as familiar with fund accounting, we have transfers and we have designations that we can do. Transfers in from any board designated funds is a mechanism from taking the funds from Fund 51, which is when we board designate those funds, and we'll see them at the end of the presentation. They're set aside, the board designates them, and no one in the system, including Dr. Gibson, is allowed to undesignate them without coming back to the board and asking to have them undesignated or having some formal action on that. Indirect costs are when we receive federal funds, there is a cost associated indirectly with managing those funds, and we are allowed from those federal programs to transfer those funds into our general operating funds and meet teacher salaries or school supplies for use of those funds. There's no restrictions on them. Interfund transfers, which you can see is 2.6 million. House Bill 206 freed up a lot of money for our school system for flexibility. Prior to House Bill 206, 2 years ago, a lot of our funds were designated in Fund 61 and they were restricted. House Bill 206 said, we're no longer going to tell you that you have to replace the bus every 12 years. We're going to unrestrict those funds. We're going to allow you to keep them in your general operating fund, and we are going to trust that the process you put in place will keep our children safe without being dictated that information from the state level. Salaries and benefits. I'm not going to go a lot into this other than to tell you total salaries and benefits finished with a positive $5.2 million. So 2 things that I will say is with a pandemic, and this is our first, all of us, our first experience in it, this financial statement is projecting a year where we had not operated at 100%. And what I mean by that is that we did not have bus trips, so our bus operators did not get extra pay. We did not do substituting or need substituting as much because for the past 2 years, 22 is the first year that we're back in school and operating at a fully 100%, even though it's a different school system, 100%. In addition, our CARES funding allowed us to transfer those positions that did our virtual instruction over to Fund 71, freeing up the general fund salary and benefits for a positive variance. Expenditures, I'm going to run down them. I'm not going to highlight too many things, but what I am going to tell you, almost every explanation when you dive down into why did we have such a significant variance of unused funds will translate back to COVID in some way, shape, or form, which it's not easy, but it's true. not being in the building 25% of the time meant that our electric bill was $100,000 less than what it was in 2019. And we know that the electric cost has gone up, and so that wouldn't make sense. However, when you're not using it and your custodians are turning out the lights and helping you to save those funds, it translates into additional funds not being used for this fiscal year. Contracted services is usually a high dollar cost, and out-of-state instruction is also a high dollar cost. And both of those, when you're only operating at what I'm considering 75% for a fiscal year, it translates into additional funds that were not expended in comparison to the budget that we had set at the beginning of the school year. Now, the audit packet, the unaudited financial statements, I think I gave you the newspaper publication, is 74 pages long with notes. Within 3 months, it will be audited and posted up on our website. Every year since I have been there, on our website is every expenditure and every presentation and every audited financial statement that the school system has had. At the end, you can see that when you look at just revenue and expenditures, $9 million of unused expenses and $1.5 million of additional revenue unexpected or projected. Most important thing is, how does our fund balance end? For our general operating fund balance, we have $15.5 million. When we close our books and we look at our revenue and we look at our expenditures for fiscal year 21, when we end, that fund balance will have $15.5 million of what we call carryover. From that carryover, we have certain obligations that we have to set aside. Prepaid items, we've already committed to prepaying some postage, and we can't take that back. There are certain other items that we prepay in advance of expending them. So we prepay the postage, and then we draw it down over a period of time. Board designated projects, 377 are Fund 11 designated projects, and the majority of that is $250,000 because a decline in enrollment. We no longer receive Senate Bill 408 funds, which is funding that we have received for growth for our county from our students, and therefore we transferred those funds in there to assist with some construction projects that we've been handling over the years. Once those two things are assigned, and I'm going to jump to the bottom of this slide and say encumbrances or purchases at the year end that possibly we had supplies on back order or commitments that had not been fully invoiced, and therefore we carry those POs over and we pay them in the next fiscal year. And those are commitments that we can't break, but we need to subtract from what our carryover balance. In addition, like last year, we've done an assignment for half of those funds for what we felt was our highest needs this year. One being JVA, which is $1 million. We are expending a lot of our Fund 71 eServe, CARES, COVID's monies to operate our virtual program. From completely data standpoint, I think what we've done is we are pivoting and transitioning our education system to meet the needs of some of our students and some of our community members who are pleased with this type of an operation, but basically it's a new business. It's a new business, and I know you keep hearing we want more money, but you can't start a new business and you can't be cutting edge and you can't attract students who learn in a different variety of ways without putting forth that money. Doesn't mean that we shouldn't look at it at periods and evaluate what is working, what is not working. Are students being successful? Are our parents happy? 400 students is, I don't know, 10% of our student base. So we need to make sure that those community members are happy, and we need to make sure if they feel safe by not coming into a physical building that we can meet the needs of every student that's in our county and every parent who needs us. Our digital one-to-one initiative, we will be adding an additional $2 million to fund making sure every student, every staff member can access, if they need access, or if they need internet, that they have a device, that if the device gets broken, that we can replace it, that they can get all the needs that our instructional team would like them to have. Buildings and fields, Mr. Osborne, I know you're going to be very happy about this. Dr. Gibson asked that we could set aside some additional monies to do that. So what we've set aside, are asking to assign from this budget, is an additional $1 million for HVAC systems. That would be like a capital budget, and preparing for, times when we don't. This is the first opportunity that we've had the ability to set up these funds and have recurring costs, have a funding source without begging Peter to pay Paul. It will also fund an additional $750,000 to our athletic fields, $750,000 to set aside to repair our leaky roofs, and $750,000 to make sure that we have safe vehicles and buses for our children and for our staff, that they don't have no heat in the vehicles that they're driving to service our buildings when they are in them. Other than that, as you can see, when we come down to our unassigned fund balance, we will still have $7.5 million in our general operating fund, and that's a good thing. And also, it is good to be able to prepare for the changes that we're making in our system. Last thought I have is what I'm calling additional revenue designations, and I think BD for me is board designated, and we started this many years ago, and the board was very prudent in doing this. That reserve, we started to reserve for construction overruns, is $4 million. When we have had hard times and when budget has been difficult, that is where we have gone. I call it our rainy day money, to make sure that our current operating revenues can meet our current operating expenses in times that are tight. Board designated annex sale, probably one of our proudest achievements, and I don't know how many of our community members actually know that we bought a $110,000 transportation building. We rented that building, half of that building. We gave our bus drivers and our transportation department a state-of-the-art facility to work in, a safe facility, which they had not had in the past, and they deserved. Rented it for 3 years, leased the other half of it for 3 years, turned around and sold it for $3 million. So basically, a county got an entire transportation department and netted almost zero for the cost of it, besides the renovation to make it completely safe. Table referendum funds is, and I will make one note on this, and this is something we've talked about for the last couple years. Table referendum funds is passed, and it's for the West Virginia Lottery, and we do receive funds from the racetrack to assist with capital expenditures in our school system. Currently, we transfer $1.6 million from Fund 51 to Fund 11 to assist us with those capital expenditures. As you can see, the projected balance at year end is $1.1 million. And over the next 3 years, we need to take the $1.6 million that we're transferring and get it down to about $1 million. Because with the additional casinos going in, those revenues have declined. Just to finish up, we do have almost $8 million in impact fees. It does not reside in our school system on our books. However, it is at the Jefferson County Commission impact fee office, and they report to us on a monthly basis how much we have in that account. There are some criteria for using those funds. I feel like we've done a great job in matching it up with other construction projects to support the growth that we've had. And I was very disheartened that they cut those fees to $1 for our school system. That being said, 408 money, I've given you the trend. I think we've received probably 5 or 6 million from that funding source, and you can see I've denoted that the past 2 years we have funded that because our maintenance department relies on that for special projects in our school systems, and we funded that locally. Funding sources, HVAC projects was something that Dr. Gibson had as a priority, and Ms. White and the leadership team, we funded an additional, with carryover from last year, we started these funds. We added $1 million into our HVAC projects, $250 into our roofs, $250 into buses and vehicles, and our remaining balance is 1.9 in the digital one-to-one. Our initial funding was 2.5 million, and our CARES funding allowed us to supplement those funds and let them remain on a local level. So at the end of the day, and I'm very proud of it, and I hope you guys are too. At the end of the day, our HVAC projects going forward in fiscal year 20 will have a $2 million balance for when we have unforeseen needs with HVACs, that we can fix them and make sure that our students and our staff have the appropriate environment to work in. Our roofing projects will have $1 million after the assignment of this funds from fiscal year 21. Buses and vehicles will have $1 million. And our digital one-to-one initiative will have $3.9 million. On top of that, we have some smaller funds that we have funded. Child nutrition has a $200,000 balance by Dr. Gibson's request for equipment repair. So they have a schedule, and they're in the same situation as our roofs and our HVACs. We now have a capital budget for their highest needs to be met. And when something breaks, a mixer breaks. I mean, mixers that our cooks use are about $9,000 to $10,000, and they last a long time, but sometimes they do need to be replaced. And unfortunately, the state of West Virginia does not do a good job in funding those things. Although I will shout out to our new child nutrition coordinator, and in 15 years, he's been with us maybe 10 months. He's brought more funding into this county in 10 months than in the last 15 years, and kudos to him. Special education, we do typically have $25,000 for special needs equipment. This year we'll have $50,000 funded for that. And with that, that's the presentation, unless you have questions.
I have some questions.
Okay, I'll do my best.
The impact fees, I was gonna ask because it sounded like we weren't impacted by the lack of impact fees or the change because we have a surplus, and so, but it sounds like you think we are impacted?
I do think that we are impacted. I think impact fees, we're the only county in the state of West Virginia, and we are a high growth county. We're only one of only 8 counties in the state of West Virginia grow, and we are one of them.
Yeah, but I thought that, and I might be wrong, but my understanding is the reason we can't use the 8 million or haven't used it is because we really haven't had growth in the school system until, I mean, it's been decreasing every year except this year it sounds like it may have gone up. Is that correct? That we have to be, it has to have an impact because of increase in students?
And I would agree with you, and I've heard that. I've never had a conversation with the impact fee department about it, but I would beg to differ with them that yes, we have not had growth, and particularly in the pandemic year, our growth has been down. But the impact to our schools is still there. We still have buildings, we still have facilities.
Yeah, but I think that's not the purpose. I don't know. I did, research it, and that was my understanding, but I might be wrong. I did contact the county commission and ask what's the issue, and they explained to me, and I don't know, that the money's there and it's not being used anyway. So, and they left it at $1 so that it could easily be, if you need it, then, you
Come
know,
and get
instead
it.
of, that was my understanding, but I don't know.
And that's okay, and I don't know everything either, but what I will tell you is I'm gonna send you an email. We just literally bought $3 million worth of land to build 2 brand new schools. That was 2 years ago. So
But that's not because of a growth in it's my understanding there has to be a growth in the population in the schools.
Our
So-
pre-K program, I mean, we have populations that have grown.
Maybe certain ones.
Yes.
I don't know.
Yeah, and I don't know what their
argued
criteria is, and here's what I would say. As your interim chief financial officer, and as a board member, there is no way that I would ever agree that we don't need those impact fees for the impact of growth. We might need to help them understand where we are growing. Our special needs population is catapulting.
Right.
And there is no way that you can separate regular ed from special ed, and they're all our kids. So whether we're not growing in one area and growing in another area, the cost and the impact is still growing.
I think we need to have the county commission maybe have a conversation where they explain, and we're all in the same, because it was, after talking to them, it made more sense, but I could be wrong.
Yes.
You know more than I do.
Well, I really
have a lot
don't,
more
but what I do
questions, so.
know is that we do need those impacts to build the buildings that we need. We need to marry and collaborate, or braid, I guess is what Mr. Banks, they say now, is braiding those funds to be successful. In addition, we can't really get SBA funds without sometimes having a leverage. They like to see that, you know, when we built built Washington High School, and we did the renovation to Jefferson, which is about a $46 million project. Part of the reason that SBA funded those projects was because we had those impact fees, and we put forth, I forget, $6 million so that they could see locally that we were participating in collaborating and bringing the funds to be successful.
I don't mean to cut you off. I just have
No,
one
wait,
question.
go ahead.
So,
You're not cutting me off.
The Senate Bill 408, as far as growth, so like I said, I know we have new growth this year.
Mhm.
I'm curious if how much of that growth is from outside of Jefferson County?
I'm not sure because I don't take that data. What I will say is we've rebounded from our pandemic hit, which is a growth, but you would have had to rebound for me to consider it actually growth more than just, I think the estimate is 250.
I'm wondering, are other counties using the online, the virtual program? Because I thought that was the idea that Dr. Gibson presented, this idea about, that maybe I'm wrong, but other counties could make use of it. So I'm wondering if that contributed to the growth in, just curious about that.
Well, if you're asking me,
Yeah,
I'm
you don't
going to
know.
say this. I'm going to say that right now we have an opportunity to start JBA and do a business. That means taking a risk.
Do
that
a business, you said?
Taking a risk. That means put the money there, and if you make that program successful and you make it available and you teach kids how to be successful in today's world, I think they'll come. And I think that Dr. Gibson and Mr. Banks and the leadership team have a good vision for it. I don't think you're going to see it break even this year. I think you need 3 to 5 years to determine, and I do think you need to continuously reevaluate what the population is that you're trying, because you're right. Right now I could be in Germany and choose to attend Jefferson Virtual Academy if it's state of the art and it's teaching us, my students, what they need to do. I don't know where the kids go, and I want to be old school and say, I always tease my kids and say, I think they just went into the cloud, you know, because I don't know where they are. I think when I look at it, and it's just my opinion, I think that we are shifting to a modern educational system, and we are in the midst of trying to define that. And I think our parents just had a pandemic, and a lot of us have reevaluated the priorities, and maybe, you know, some of them are homeschooling. I don't know if we have the data on
Maybe
it.
Dr. Gibson knows.
I think she knows more than I
thank
do.
And so another question is, I thought we already had the digital one-to-one taken care of. I thought that all the students already had them. So now you're saying this another 2 million?
I am, and when I look at it from a financial perspective, and talked and determine our needs, that's replacing textbooks. I mean, you're gonna have every year a certain percentage that's gonna need to be funded. You're gonna have different things that are going to be occurring. You're going to have staff and students and changes and updates, and any type of professional development I've seen on it is we can undesignate it if it's not used, but right now I think we need to set it there because we literally, I think, are just getting ready to hire the last technician to service us. I mean, they've got some great ideas. You're basically going to drive through, drop your laptop off, get it updated, and move on. That may materialize or may not, but you have to fund. You know, kids break them.
I understand.
Yeah.
I'm just asking.
Oh yeah, that's
because
the purpose of it would be that we have to have those funds set aside.
I understand.
More even than your roofs and your HVAC, because at this point students have to have those devices.
Another question. I don't.
Okay, go ahead.
You said you bought a building and sold it, and I'm wondering why we're renting the adult ed building then.
That's a good question, and it's been discussed at least on 2 occasions. We do receive the funding to pay for that through the adult ed funds. I think that I've heard some, and I want to speak because sometimes I hear things, and there are other reasons where we go down a different direction. But we've had that conversation. We've strategized over it. We've collaborated over it, and at this point, I don't think a decision has been made to move that into a space before we look at maybe the employee space in the central office and other places that are really lacking in what we need to do our current job.
I think
that would be my speculation.
My last question is, it seems like this might be a good time, given we have some extra money. You know, this audit is just about finances. I don't get the impression that it's a comprehensive, well, are you spending this money in a good way as far as education? And it may be a good time to hire a consultant who would evaluate how we're spending the money and, you know, futuristic, and are we making the best use of the funds? Because it could save money in the future by investing a small amount, and there may be volunteer organizations that are willing to do that.
I always think I always think looking at things in a deeper dive like that is a good thing. So one thing I would just say as a note is that specifically narrow it down to what it is that you want evaluated and make sure you give parameters.
Well, I mean, right now, the achievement is pretty low. I mean, I looked at the scores, and yes, there's COVID, but I mean, maybe there's something that we could be doing differently, because we don't really, I mean, I don't remember ever talking about achievement since I've been here, except for the time when I asked for scores. You know, we were talking last year about first quarter versus second, and so I just feel like there may be some other set of eyes of people that are qualified and experienced in, you know, looking at the use of money in the best way. Because it's like we're usually in a panic reaction mode, and maybe some planning. I mean, I can't imagine one person, Dr. Gibson, has to do all this, and it's just, you know, that's a lot. So
I think it's an absolutely excellent idea, and I am always open to being better and achieving more. Always. I don't think that there's a day that goes by that we don't learn something new in education, which is one of the things I find attractive about it. But also, the one thing I like is that we truly learn. I mean, we learn, and that's the way you do learn, by those individual audits and being more efficient. And we've had many since I've been here, and I'm sure Dr. Gibson has had many where she's been, and Mr. Banks has also. Once you get that data, looking at that data and deciding, taking action is probably the harder piece. But you're absolutely right. We are in a good position that if you wanted to look specifically at saving money in certain areas, we could do it. We could probably give you a list of the things that we've covered over the last 15 years. I'd love to have a purchasing agent.
Well, or just how to spend it in the best interest of students. So, I mean, how does that happen? Do we have to?
Well, that would be working with Dr. Gibson, and what I would say, and what I've always said, and I changed a little bit today, we can do anything, we can't do everything, and today I did say pandemic might not be a bad idea to just breathe and you know, focus on one thing just because we've got so much going on. But absolutely, I mean, any direction that the board and Dr. Gibson and any of my leadership team members, I can happily strategize with them how to fund it, or where we could possibly trim funding or switch funding. I mean, that is usually the most of the conversation. If we want to do this, what do we want to curtail in order to do that? It is usually what we have. But yeah, I think they're great ideas.
How can we make the most use of what money we have as far as focusing on student achievement? Because in the end, I mean, that's the goal, or it was the goal. I don't know what the goal is anymore. But it was. It should be a focus, and I just feel like, I know we're responsible. The board is responsible for doing something regularly to encourage achievement. So I suggest that we, you know, have a third party. Independent third party give an evaluation, and I guess, you know, a lot of times I say things and then it's vanished, you know.
Yeah, it's a lot of priorities that we have to prioritize. However, I think it's an excellent suggestion, and narrowing that down into an action item, I would say that would be a board and Dr. Gibson decision, and I could help and support it in any way, shape, or form. And for me, definitely I want to spend our money the best way. I live in the county, I pay the taxes, and I do monitor it, and we push that out to our staff, but it's always nice to have another pair of eyes to provide suggestions to be better and to achieve higher.
So, I mean, does it require making a motion and?
Yes, it would require, yes. It would,
So
I
if
don't
I
even,
made a
no, it wouldn't
motion-
be a motion. I think it would just be a discussion. I'm not sure what process you would go through. You know, you could strategize with the board. I would think the board would have to determine where they wanted to focus and do that, but it's actually beyond my bailiwick.
Okay. So, Mr. Osborne is saying that we need an item on the agenda.
We're gonna cut this off.
Okay. So,
Well, I'm requesting that the item be put on the agenda, and that's the best I can do.
okay.
Any more questions on
I don't think so.
the financial report?
It'll be published in the newspaper and pending, I did mention GASB 84, it's a new requirement, $2 million at our school level that we are now required to put into our fund. It'll become our 7th fund. I'll be working on that over the next month and sending revised financial statements out. It is a lot of work, but we need to do it because we have a bond, and it may affect our bond rating, and we want our interest rate to be the best that it can possibly be. So just another mandate from the state.
I do appreciate that you put the money in as well for the HVAC, because I know we have talked about that, 1.6 million.
And the roofs.
Dwindling away, so for the roofs and HVAC, yeah, we definitely need to do that where there's an extra bit of money for something else.
Looking at other professionals, remaining other. I don't know, I'm gonna have to send a FOIA out.
Okay, is there possible action on a retention and recruitment plan?
Couldn't
Which one do you
get me
want?
for some reason.
Yes, sir. Give you everything here.
Thank you.
Hold on, you got a couple more. You
So,
gotta get
Jason, if you
Thank you.
could pull up the
Wait a minute, one more.
presentation. Thanks
Gary.
again.
Mr. Cable.
Hmm?
Last one.
Thank you.
Ma'am. Excellent, as always. Yes, ma'am, thank you.
Okay, so, this is the fourth, I think, presentation that we've done on retention and recruitment, where we've given you statistical information. We surveyed all of our staff, brought back to you the results of the survey, went back and broke up into action committees based on the survey results to bring an action item plan for the board. So one of the things that you'll note on here is that this is a collaborative project. First and foremost, I want to thank the staff. We had hundreds of our staff who answered the survey and who have subsequently served on committees, who've provided suggestions. Our Human Resources Department has worked pretty tirelessly, finance, instruction, all of the principals. We have held meetings and gone through all of the action items. The Faculty Senate, we have meetings and went through those. The union reps have gone through them. So we've really gotten a lot of great ideas on these. There are 27 separate action items on these. So I want to be clear right now that my strong advisement to the board tonight is going to be that I give you a very broad overview of here are the types of actions that we've looked at. They will have dollar amounts attached to them, timelines when we think we can do them. My advice is to hold a special session completely for nothing but this retention plan and long-term planning, because there are some
it's a good idea.
near things here and some long things here, and it's
Every 100 questions and we won't be here.
I believe it, ma'am. Yes, ma'am. But it's the thing is that this is our democracy takes time, and sometimes it's messy, and sometimes it's conflictual. And the reality is, all those voices need to be heard, right? As sometimes as frustrating and as people get with each other, it's important. It matters, and you come out with a better product at the end. So just like lean into the discomfort of that sometimes and keep your mind open and be willing to hear the things that we can do better. So a lot of this was about talking to folks about the things that we can do better. So I want to highlight a couple of these for you. So I'm going to let you know, Jason, when you scroll. So I give you just a lot of data on page 1, and this will be posted up on the website. So if you could keep going, that's a lot of data about how we got here in recovery. A guide to the action items listing where it shows, and you guys talked about this with having a code, sort of like a codex where you could tell what each thing was. So proposals for action. A couple of things. I'm going to be super brief on these. Substitute support for school. Our staff are, I can't begin to tell you how valiantly they are struggling out in schools with staff shortages. The staff up here have been out in schools subbing regularly. I myself, and since school started, I've subbed in the 2nd grade, I've subbed in the 4th grade, I've done a high school math class, I've been in the kitchen. It is unbelievable what our staff are doing. Now, is all of it working out great? You heard from some folks tonight. We do have some places where we really are struggling to keep staff, where we'll bring staff in, and quite frankly, teaching is hard work, and they are sometimes struggling to stay in there. So one of the first things that we have recommendations for are about substitute support for schools. Day-to-day subs are nearly impossible to find. Our best ones we've sort of sucked up into long-term positions, and that proposal is about us creating sub positions, full-time sub positions with benefits. Our sub needs are so incredibly great right now that relying on someone who's willing to go day to day for $100 is just, there's no well right there. with additional support for special education personnel in school as well. Schools that have very high need special education populations, T.A. Lowry, Jefferson High, Blue Ridge, Washington High, Wildwood Middle, Charlestown, Driftwood, and Harper's Ferry. We would ask for additional service personnel, special ed positions in those. Again, these are proposals with dollar amounts to them, as you can see. For this, all of these positions right now would be, the cost of these would be covered by our current savings on both unfilled positions and subs. We spend about $3 million a year on subs, and we're not spending it because we're not finding them. So a lot of this would be the cost of adding benefits, and that right now we can absorb that because we have those additional funds available. We got some great ideas from staff. If you could scroll up to the next one. One of the ideas, and this actually came from Charles Wall, and I thought it was a great one. Right now, if a retiree wants to turn and work for us as a sub, they start off at 0, as if they are a first-year teacher, no experience, right? They have to work their way up under the way that the West Virginia Code is set up. We would love to see some policy changes where they can come back in and sub at the rate that they left at for their valued experience. They would probably be more likely to come back and sub for us. One of the things that I want to draw particular attention from the board that I strongly recommend be one of our highest priorities moving forward is a bus driver equity plan. I don't know how many folks are aware of this, but every other service position, there's a Secretary 1, Secretary 2, Secretary 3, Cook 1, Cook 2, Cook 3. There's a place to go to gain additional pay. In West Virginia, a bus driver is a bus driver is a bus driver. There's nowhere for them to go. And like any other profession, we have some amazing bus drivers. My son loves his bus driver more than some of his teachers. She will text, she will cover him, she will make sure that her kids are fed and taken care of. She's amazing. And so we actually had a group of bus drivers, and actually I want to give a shout out to Lisa Alberti, Cynthia Carper, and Crystal D'Angelo. They worked with J.R. Holland to create a bus driver 1, bus driver 2, and bus driver 3. And we will be recommending strongly to the board that we adopt a policy that puts those pay ranges in place that would increase pay scales to D, E, and F. Those are long overdue, much needed, and I believe that is something that the board will give some direction on moving forward for us to continue to pursue that. That has to be a policy change.
Is that the only service personnel classification that doesn't have steps to it?
Yes, sir. That is currently the only one that I'm aware of. Correct me if I'm wrong, Amy. Yeah, that's the only one, which is a travesty, quite frankly. And I will say that will be entirely local because the state has no such designation. So we would be the ones creating in Jefferson a bus driver 1, 2, and 3. The next page, expanded preparation schedule. Essentially right now, teachers come back and they have 3 days to get school open. Of those, there are about 10 hours of mandatory, before the start of school, thou shalt have this staff development from the state. So they start the year off under the gun. We spoke with the faculty senate and they had some really good ideas. We had originally said add 2 days to the contract. They were not, they felt like there wouldn't be consistent interest in that. Some folks would, some folks wouldn't. So we altered that recommendation to be a flat rate to come in for class prep, and a commitment from us that it would be devoid of any staff development. There would be absolutely no staff development on those days. It would be nothing but get your classrooms, your lesson plans ready. Next one is the extending an attendance bonus to service personnel. Currently, the state pays that attendance bonus for personnel, professional personnel. Strongly recommend that we extend that to service personnel. All due respect, they're the backbone of the school system. They're what makes this place run. And It's well deserved. Next page, you'll see right now, subs and coaches have to pay to come to work for us. There are background checks and certifications that they have to obtain where they have to pay out of pocket before they can come in. Coaches in particular, you have to pay the WVSSAC $500 to come in and get your $2,000 stipend for working thousands of hours. We're recommending that we pay those. Long-term sub equity, folks may not be aware of this. We have about 65 long-term subs in our school system. These are people who have bachelor's degrees, but they didn't go to school to be teachers, right? So they have always been given the same salary level as their peers in teaching, with the exception of they get none of the levy payments. We provide levy payments to, those levy checks go to certified teachers, not to long-term subs. And a lot of discussion with the faculty senate, and there are mixed feelings about this. There should be an incentive for you to be a licensed teacher. It's hard work, and you need good people to do it. So there should be an incentive to do that work and become a teacher. And actually, this came as another suggestion that because we had some folks who said yes, give it, and some folks who said no. And the suggestion is that once a long-term sub comes in and actually gets their certification, that we would retro back pay the last 3 years worth of levy checks to them. If you really want to come in and you want to be a long-term sub, but you're not willing to go and take the classes and get your certification, you just want to be a long-term sub because you don't want to do the work of that, well then why should you get paid the same as somebody who spent their life really student loans and working away and student teaching and doing all the work to be a licensed teacher? But if you just need some time to do that, then we've got you, and pay it retroactively. So again, great suggestions from the committees about creative ways to do this. Teacher mentor pay, paying strong teachers to mentor others. The therapeutic services pay scale, bus operator trainees, the service career ladder, and again, those are ways that we have to create ways for service personnel to have additional income as they get more education. Staff development autonomy. The social emotional engagement funding, right now principals are doing most of this out of pocket. And the second piece of that is the allocation for student materials for service personnel. Right now, teachers get faculty senate funding where they get money to spend for kids, materials, and items in their classrooms to keep them from paying all of these things out of pocket to get things for their kids. Service personnel have never gotten that. So one of the things that we did is I sent out a proposal to ask, number one, to create a senate, a service senate where, again, just like faculty senate, they would meet once a month with the superintendent and leadership and tell us exactly what their concerns are, the information that they're receiving, how we can help them. They make sure that they get accurate, direct information, not off of social media. And it would also give an allocation to each school so that if you're a classroom aide who wants to start a chess club, guess what? We can buy chessboards and chess pieces. If you're a bus driver who wants to have a behavioral incentive plan on your bus, you don't need to buy those toys for the toy box. We can reimburse you for that. You want to do good things for kids. You shouldn't have to do it out of your pocket, particularly when you're not making as much as you should be in the first place. Additional training and support in special ed for service personnel. We heard loud and clear from service personnel, and Beth stated, and you will hear it over and over again, the unbelievable level of needs that we're seeing in kids right now. Were most of you to go into I was in a kindergarten class the other day, had 22 kids in it. One was a child who suffered from fetal alcohol syndrome, who has sensory issues. Another were 2 students who are in the process of getting diagnosed with autism. And it was unbelievable. Had another student in another room, one-on-one, by themselves in a completely separate room because it was just tearing the place apart because it was a second grader who came to school for one semester, and then came back out on COVID, out for the entire first grade year. So now he's in second, and you spent 3 months of your life actually in real school, and now you're in the second grade, and you are just off the chain. So really getting some additional training and support from our staff who are seeing behaviors that they are ill prepared for. Tuition reimbursement. Now these say we're financially restrictive. So keep going to the next one. These say financially restrictive R&R projects. A couple of these we've heard loud and clear from our staff. We need better pay. Absolutely agree 100%. There are limitations to that. So some of these are ways that we are looking at being creative in terms of badging and credentialing. And this is, you may have heard of micro-credentialing in other areas. Things like behavioral management, safety, cultural competency, customer service. Folks who completed those training courses could earn additional badging where they could earn additional stipends that would supplement their income. Loyalty contract signing bonus, basically a payment if you continue to sign your contract year after year and complete your full contract. There would be a loyalty bonus with that. One of the excellent ideas that we got, if you could keep going, a step shift. So we had looked at a pay scale shift for professional and for service, which essentially would be how many years of experience up would we have to shift everyone to be competitive with a Washington, Maryland. Right now, that would be about $20.7 million per year if we came up to the same starting pay as those for both service and professional. We don't have an extra $20.7 million a year. And our staff recognized that, and actually this idea came out of Faculty Senate. Every year, the West Virginia Department of Education provides what's called a step increase. It's basically you have a year more of experience, so you step up to the next level of pay. And that runs anywhere from $400 to $700, depending on how experienced teachers are. And the idea would be that we would have a local match to that step pay, so that over time, it would incrementally increase pay without us doing some heart dropping that we don't have. So I can't manufacture $20 million a year, but I also can't look people in the eye and just keep saying, well, I don't have $20 million a year, so I can't help you. That's not an option. So looking at incremental increases, and those would also allow us to reward folks who've been here the longest and who have the greatest service and the greatest expertise. Cost of living payments because of the cost in Jefferson, child care. There are several no-cost ones like paperwork requirements. We have a committee who is looking at and will be conveying to us what paperwork requirements they think we can reduce. Lesson planning and reporting, communication structure, and we also have additional recruitment resources in terms of us having to reach far and wide. Used to be people would, back in the day, come to us, and now you have to reach out and chase them. I gave a lot of statistics on the drops in individuals going through education programs. I think I'd shown you earlier that while there's been a 5.27% decrease in West Virginia students in the last 6 years, there's been a 53% decrease in folks going into education. It's become a very different place right now. It's very much under siege, so it's not incredibly popular. So what I'd like to do is to set up with this board a special meeting for us. We'll post this online. The board has an opportunity to review and to give us feedback, and then we come and ask for specific action items. Some of these require policy changes, like the bus equity plan. So with a special meeting, we can sit down and go through what policy changes would be necessary and get those enacted.
You said you're going to post it online?
Yes.
So the public has a comment? Is this for public comment too?
Certainly.
Oh, okay, so it's gonna go out for public comment.
Yes.
Oh.
We'll post it up and anybody can come in. We'll have a comment. We'll have we'll set up one of our pass-throughs where you can click, type in here, and have a public comment on it. Yes. So we can certainly do that.
Can you just clarify two things? Oh, did you have a question? Well, the social emotional engagement, I couldn't figure out what that meant. I mean, I read all of this and then I couldn't figure out, are you saying that, was it just, I think you mean that not just the new teachers get the 15-year step up, but also those existing teachers get a 15-year as well? Or did I?
Okay. I think I understand your question. If I don't answer it, you tell me, okay?
Mm-hmm.
So, your first question about the social emotional engagement funding,
Right.
when we spoke with the principals, one of the things that they said is that they are struggling to help support their staff, and they were expending out of their own pockets things like, let me buy pizza for the staff on Fridays. Hey, let me, here is a, I'm trying to think of some of the things that they had. Some of them are paying for folks to come in and do stress reduction classes with their teachers. And what we said was, look, we'll have a fund. You can request things out of it if you have something that you think will help your teachers and your service personnel and their mental health and social emotional support. You tell us, we'll have a fund for you to be able to draw from that so that we could monitor what it is that you're interested in. And the other one was actually, what we looked at was if we jump everyone up, I think it was 9 years, how many? No, 14 years?
Yeah. Well,
14?
it was if we shifted it and
Right.
we eliminated 0 to 13. And
Right, and started on
at
14, right.
And then recalculated it.
So to your point, yes ma'am, it was both, it was everybody. So you would come in at year 15 and then everybody else would bump up. And then we got questions about, 35, are we still gonna have a cap at that? Those would be things we need to work through in the special session.
Okay, and that's not against the state, that's allowed?
We would, on many of these, we would either have to get a waiver or there are some, we are able to do locality pay under certain circumstances. So again, part of this is, as Beth said, you can have just about anything you want, but you can't have everything. We can't do all 27 of these. Even if you had unlimited money, we couldn't. We don't have the manpower or the bandwidth. So some of this is things that would require policy change. Yes, we would have to go to our legislators, or if things that required a waiver, we would have to go to the West Virginia Department of Ed.
Interfere with retirement and things.
I'm sorry, ma'am, can you say that again?
I just see it affecting retirement and
Well,
the
I'll
way
be
that
honest with you,
works.
our levies are beyond what other systems are paying. But,
Yes.
But our retirement is still based on that. So, that is not a conflict. So I'm not sure what of these would be a conflict monetarily.
Well, if you've only worked here for a year and they're giving you 15 years, you're not, suddenly you're able to, you qualify for retirement, according to the state.
Not just with 1 year, no.
Well, that's what I'm saying. If
Right.
somebody's,
No.
I see what you're saying. If we're not very clear about the parameters, it could lead someone to have, which is why, especially for some of these very big ones, like I said, we can't chase every one of these rabbits. They are very complex, affecting thousands of different processes that we do in individuals. Things like substitutes, where for the first 10 days you're at one pay rate and then you switch to another pay rate once you've had 10 consecutive days, and that's a manual process. And then once you've had 30 days overall, you switch to another pay rate. There are some very bizarre, complex personnel and payment rules in West Virginia. And the more that we attempt to make changes for the betterment of our staff, some of those we get tangled and we have to go to them and either ask for a waiver or ask for a policy change.
I would like another paper copy of that. please.
I will post these online. First of all, I will get Hans to create like a pass through so somebody can read this and then click on it if you have any comments. And then I will deliver paper copies to all of the board.
Okay, we're on to action of approval to change our regular scheduled board meeting on October 11th to October 12th because of a holiday. Is there a motion to that effect?
So moved.
Is there a second?
Second.
Discussion? All in favor say aye.
Aye.
Opposed, no. Motion carries. Superintendent's comments.
No, sir. I feel like I've spoken enough.
We do have an executive session. It does involve personnel. And I need a motion to go into executive session. And there will be action.
So moved.
Second?
Second.
Discussion? All in favor say aye.
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 Opposed, no. Motion carries. We're going to take a 5-minute break.